और इस कार्यक्रम की गरिमा को बनाए रखें। माननीय कुलपति महोदय, प्रोफेसर डॉक्टर SP अग्रवाल सर, साई नाथ विश्वविद्यालय, सम्मानित वक्तागण, आदरणीय रजिस्ट्रार प्रोफेसर डॉक्टर राकेश डेविड सर, सह संरक्षक प्रोफेसर डॉक्टर के राजेश्वर दत्त सर, छात्र कल्याण निदेशक डॉक्टर KC प्रसाद सर, शैक्षणिक डीन डॉक्टर भाग्यश्री मैम, विभाग के प्रमुख, संकाय, प्रशासनिक अधिकारी, प्रख्यात शोध विद्वान, मीडिया प्रतिनिधि, शिक्षकगण एवं सभी उपस्थित लोग, आप सभी का साईनाथ विश्वविद्यालय के इस 2 दिवसीय राष्ट्र सम्मेलन में पुनः हार्दिक एवं अभिनंदन। मैं साक्षी शर्मा, विधि विभाग की छात्रा,
और मैं हर्षवर्धन भट्ट, कृषि विभाग का छात्र, आज आपके साथ इस गरिमामय कार्यक्रम को संचालित करेंगे।
इस सत्र से हम पारंपरिक ज्ञान, आधुनिक औषधि विज्ञान तथा उभरती तकनीकों के समन्वय पर आधारित विशेषज्ञ के द्वारा व्याख्यान सुनने का अवसर प्राप्त करेंगे। मैं सभी से अनुरोध करती हूँ, सभी लोग अपना अपना स्थान ग्रहण करें। सर, मैं आपसे कार्यक्रम को शुरुआत करने की अनुमति चाहती हूँ।
Towards the beginning of this auspicious occasion, we now present Welcome Dance, reflecting our rich culture, heritage, and spirit of hospitality. For this, I would like to invite Jweta Sarkar from Agriculture Department.
फूले बम्बुआ फूले फूले गोरी खरन सिंगार मालनिया घर वाले आए कर सो सकार बना फूल रही सरसों सकल बना फूल रही सरसों
Thank you so much, Joeta, for this beautiful performance. सम्मान भारतीय संस्कृति की वो परंपरा है जिसके माध्यम से हम ज्ञान, अनुभव और योगदान के प्रति अपनी कृतज्ञता प्रकट करते हैं। आज हमारे लिए यह सौभाग्य का विषय है कि हमें ऐसे विशिष्ट अतिथियों का सम्मान करने का अवसर प्राप्त हो रहा है। यह सम्मान केवल एक औपचारिकता नहीं, बल्कि हमारे संस्थान की ओर से उनके प्रति आदर, प्रेम और आभार का प्रतीक है। Now, I would request Dr. Bhagyashree Ma'am, Dean Academics, to kindly felicitate Dr. Satyajit Saurav Sir. Everyone, please give a big round of applause. Moving forward, I would request Dr. Manish Majumdar Sir, Principal of SOP and Associate Dean Academics, to kindly felicitate Dr. Manik Ghosh Sir. Everyone, please give a big round of applause. Thank you, sir.
And now, to begin this technical session, it's my proud privilege to introduce our speaker of the day, Dr. Satyajit Saurabh Sir, Officer in Charge in DNA Fingerprinting Laboratory, Bihar State Seed and Organic Certification Agency, Government of Bihar, Mithapur, Patna. Dr. Saurabh sir has extensive expertise in DNA fingerprinting, molecular analysis, and quality assurance in biological and agriculture system. Sir, we request you to kindly share your visionary thought with us.
Hello. A very good afternoon to all the dignitaries sitting over here, the professors, the participants, the students, and all staffs associated with this conference. I'm very much thankful to the Sai Nath University for giving me this opportunity to speak something about the IKS and its role in preventive and personalized medicine. So I am here to present a talk on this topic, and I think we are running late, so I just try to make it faster. So may I start? It's fine. So this is all about the topic, the role of IKS, the Indian Knowledge System, in preventive and personalized medicine. So first, I would like to talk about the Indian Knowledge System. This is a division of under Ministry of Education. It is regulated by AICTE, and it is just trying to cover science, technology, arts, philosophy, whatever we have in our ancient knowledge system, ancient wisdom. It is based upon that. It bridges the traditional knowledge with contemporary needs, rejuvenate cultural heritage, and develop future innovators by utilizing those the knowledge which we have in our ancient science, technology, arts, philosophy. As we all know, we have uh, numerous texts and the art forms are there, which gives us immense knowledge in the, different fields, and we have various scholars known for these things. Those are the Susrit, Charak, and the Gargi, Yagyavalakya. There are so many names are there. Aptamitra, Lopamudra. There are so many names. The scholars are there. The women scholars are even women scholars are there. So this is all about Indian knowledge system, which is being promoted by Government of India for last 10, 12 years. So why it is important? Important because we have so many literatures. As we know that Dalton is giving, we are giving credit to Dalton for atomic theory. But previously we have one that is by Acharya Kanad, who has given the theory of the atomic theory. He told us about the atoms as Anu. So there are so many works based upon chemistry, and which is the basic fundamentals for the drugs we are preparing, okay, by going through metallurgical process or anything else. So I just want to recall a statement from Hans Peter Deur. He is working upon the quantum physics, okay. He is working upon quantum physics, and he's told that whenever I used to talk about the quantum physics, I always figure it out that is it somewhat related with the Vedant, philosophy of Vedant given by Adi Sankaracharya, who told oneness in duality. So this is all about what he has told. So this is very much important remark by this great physicist about our ancient knowledge which we have. So taking these things in mind, there is some national education policy was designed to integrate our Indian knowledge system in the education of higher school and college going student. Here specifically I would like to emphasize the the clause given for medicine, the clause given for the medicine syllabus curriculum. The students who are enrolled in UG program in medicine may take a credit course in the first year on Indian system of medicine, which will provide them with a basic understanding of the Ayush, Ayurveda, Unani, Siddha, Rokpa, and homeopathy, naturopathy, these things. And during the second year, student may take a 2 semester credit course on the theory and practice of any one of the Indian system of medicine. So this is all about the knowledge system we have recorded in our documentation. We are working for documentation of these scriptures also, because these are the present in various other texts like Vedic era का कोई text book है उसका अलग अपना scriptures है. We are trying to translate all those things to stop even biopiracy. I will talk about that later. So, utilizing Indian knowledge system in medicine, how it is important. Modern medicine was largely disseminated in recent centuries by several, you can say, the cultural migration, the migration of people, the explorer, the invaders. So there are so many dissemination was recorded in recent centuries. Progress emerged from empirical knowledge of traditional medicine with scientifically proven evidences, particularly Ayurveda, Yoga, Naturopathy, Unani, and all those. The world's oldest and most comprehensive framework for health and wellness is our Ayurveda, emphasize maintaining health in harmonious balance rather than merely curing disease. How we are going to do that harmonious balance? It is all about the kaph pit, you know, vat kaph pit. So this plays a significant role in preventive and personalized medicine. I will talk it. So we have some known saints and seers who are basically known to make this healing science in a wisdom. So we are getting these things from the documentation they have given. The Susrut, the Charak, and Vagbhat are the three great uh, sages known for this work. The IKS in medicine. Dhanvantri is divine physicist. Charak is known for internal medicine. That is, he has written Charak Samhita. He has text. He used to make all his studies and research in a Charak Samhita, Susrut for surgery anatomy. All his work is well documented in Susrut Samhita. There is Vagbhat. Vagbhat, what he did was he just simplified the work of the Charak Samhita and Susrut Samhita. Then the Kashyap Rishi was there. Then Nagarjuna was there. Nagarjuna has basically worked upon chemistry, how to get metals from, how to make bhashma of metals as a, you can say, medicine preparation, you can say. So their works from the bedrock of Ayurvedic practice, offering deep insight into disease anatomy, pharmacology, and preventive health. They basically emphasize the holistic view of health. Holistic view of health, where we are trying to figure out is there any element in body or mind or soul. So we are just trying to do it in a holistic manner. So the three foundational stages of Ayurveda are, as I told, Charak, Susrut, and Bhagavad. All these three are well known for their contributions to the medical science. The herbal healers, as we are talking about the Ayurveda and herbal healers, there is one statement in Astang Hridayam where they says that there is nothing that can be wasted in reverse. Everything is being used in any form for many purpose if you can. So there are so many things like these are the plants commonly used in our several homemade medicine, the traditional medicines. These are the commonly available, you can say, the component, okay, like amla, turmeric, ashwagandha, ginger. And what are the secondary metabolites? What are the active ingredient, the phytochemicals available in that is mentioned over here. I have tried to make it in tabular form, the phytochemicals, or you can say now the phytochemicals are also with modern science, integration of modern science. These phytochemicals are now known as epidrugs, which can change the epigenetics of an individual. So this is all about the phytochemicals, the sources from where we can have those phytochemicals and their importance, their biological role in our body. So the 5 element and 3 dosas are there documented. It is basically very similar to the traditional knowledge of China. So there are the 5 elements and 3 doshas, 5 elements, as we all know, we are made up of, and the 3 doshas. Due to these 5 elements, availability and our lifestyle, these make us in dosh. They create dosh. There is 3 things: prakriti, vikriti, and balance. To maintain balance, so there is one prakriti is there, that what naturally we are, how we have to be in, you can say, dincharya, ritucharya. So what should our daily routine, as per our lifestyle, what we have to go for a daily routine, like we have to, when we have to wake up, when we have to sleep, when we have to drink water, when we have to eat food. So this is all about the dincharya, and the ritucharya is accordingly we have to, what we have to take is as per the season. So by taking all those things in consideration, we can uh, adjust our body to prakriti, the prakriti we have. And if there is any ailment, any changes in all those things, then we can go for the vikriti, the changes, the imbalances. And to make those vikriti in a harmonious manner, to again come back to the prakriti. So this is all about the prakriti, vikriti, harmony. This is prakriti is our inherent constitution, as I told. विकृति इज करंट स्टेट, जो भी इम्बैलेंसेस हैं उनको, और हार्मनी जिसमें बैलेंस करते हैं प्रकृति और विकृति, जो बैलेंस वे में चले, वो स्वस्थ जीवन वही हुआ जहां पे हम हार्मोनी मेंटेन करते हैं बाय फॉलोइंग द दिनचर्या और ऋतुचर्या कॉन्सेप्ट. और इवन वी कैन गो फॉर द पंचकर्म. So this is all about the 3 significant concept of human health. So basically coming to the point, IKS in preventive health, as I told that if we follow the Ritucharya, Dincharya and all, we can yoga, exercises, oiling, oil massage. So we can go for a proactive health management where we can prevent any disease to come. As for example, there is the curcumin has role in preventing a body from cancer. So I will talk about this later while discussing on the epigenetics and drug role. So this is all about the dincharya, daily routine. Ritucharya is a seasonal regime. As we always used to listen that we don't have to eat dahi, curd in Bhadra. We don't have to eat leafy vegetables like sag and all in Savan. So we have to follow all those things. So this is all about dincharya and ritucharya. Then the rasayana, what we are taking is in a chemical form, like the chemicals, the phytochemicals, like amla, triphala, ashwagandha, or anything else. Then the yoga and meditation, as I told, that exercise is also very much important for our life. And the detoxification by going through the panch karma strategy, which involved 5 therapeutic procedures. The Vamana, Virechana, those are the Vamana, Virechana, Basti, Nasya, Rakt Mokshana. The Virechana is, the Vamana is the therapeutic strategy to vomit. If we have anything toxic in our body, then we can vomit it. So this is called Vamana. Then Virechana is purgation therapy to eliminate pitta toxin, which is associated with our stomach. Then there is Basti. Basti is basically anema given for the rectal cleaning. The Nashya is for nasal administration to clean the sinus and head part. The Rakt Mokshana, which was quite not significant in recent studies, it used to randomly puncture your body for to pull your blood and to tell that blood is being purified by the Rakt Mokshana. All these, the Panch Karma involves one, you can say, preparatory phase, which has 2 things, Snehana and Swedana. Snehana is for internal or external oil application, and Swedana is for steam, taking steam on the body to detoxify to break the toxins and simple molecule to go for Panch Karma for final detoxification. Then the IKS in personalized medicine, individualized care. We can say that we can go for a Prakriti analysis through Nari Pariksha and all. We can check the soul, the vata, pitta, kapha, okay, through Nadi Pariksha also. There is Ayurgenomics, where we are just trying to interconnect the logic of genetic, as we have the genome sequence of human body. So we can just try to relate with the drugs we are using in Ayurveda, and with that changes in the gene we have inherited. So when we integrate those two things, the Ayurveda with genomics, it becomes Ayurgenomics or Ayurgenetics. It is highly being studied these days. Then we can talk about the tailored dietary guidelines. Again, the recommended guidelines as given by the WHO and all. So there is also a guideline given for treatment in different dosas. So key concept of Ayurveda and genetics. Ayurveda also talk about the beach, okay, the genes. So these are the genetic terminology. Ayurgenomics, as we have discussed. Epigenetic and lifestyle, as what we eat is going to change our epigenetic. What is epigenetic? I can just talk to 2 to 3 lines. Epigenetic is all about that we have the cells and they are expressing differently in different part of body. Okay, so we have I'm a human, I'm a man, as an individual, my each cell has same genetic constituent, same genetic makeup, okay, you know. So now what I can try to say that if the liver is working, so there the cell is regulating in different manner, while if I talk about the muscle, there the cell is expressing in different manner. This is all about the need of body, the need of part of body, and accordingly they are expressing their genes which are beneficial to regulate their system. Okay, so if I go and stand in a place near to equator, now some genetic changes in my body happens. It was temporary. What happens? Melanin secretion increases. Okay, my complexion goes darker. If I go to the hilly areas or at higher altitude, skin complexion is going to fairer. So these are all the epigenetic changes being governed by the external factors, the diet we are taking, the lifestyle we are having. So it is all about the epigenetics and lifestyle. Now, what is the preventive approach? So we have in ancient days we have the Gav Sanskar and Sadvit to manage everything. Even we have we can say that we can't marry in a same gotra. What happened by marrying in a same gotra? So it is more chances to get the recessive gene, the gene which is not desirable, those genes which are responsible for hereditary diseases, syndromes. So to stop those hereditary disease to come in the population, we stop marrying inside the gotra. We always try to make distant relation, even especially we want to marry in a different gotra. So this is all about to stop the transmission of recessive gene. The molecular impact, as we have discussed, the daily and seasonal routines, detox therapies are considered to reduce oxidative stress and regulate immunity at a molecular or gene expression level as per epigenetics. So this is all about to maintain one's uric prakriti. Then the phytochemicals and epigenetic modulation. As I was talking about the nutrigenetics, means what we are taking and what is it is going to, how it is going to affect our the genetic makeup. So for example, curcumin modulates DNA methylation by suppressing the action of DNA methyl transferase. Curcumin modulates microRNA expression by upregulating the activity of many tumor suppressing microRNAs. So the role of turmeric can be seen in as preventive measure for cancer, you know, cancer therapy. Then the Resveratrol, which we can have from grapes and berries. It is also known for suppressing the tumor, the oncogenic cells, and oncogenic cells, and down regulating the kappa factor, NKF kappa factor, for which is responsible for cancer. Then the compounds like sulforaphane and all those may play a good role in chemoprotective manner to treat some diseases. Integration with modern healthcare, if I talk, so modern healthcare is basically based upon the predictive, preventive, personalized, and participatory, where we can say that predictive, what we are going to predict that what disease the person is going to have in future. So we can go for some omics based studies like genomic, proteomic, metabolomic, transcriptomic. So when we go for those studies, we can check that they have this genetic makeup. These genes are being expressed normally, abnormally. Proteins are being uh, uh, synthesized, which may create some risk. So by going through all those things, we can predict that what type of disease the person is going to have in future. Preventive, getting all those things, we can also changes our behavior, changes our environment, changes our the molecules we are taking in food. So all by taking all those things in consideration, we can go for a preventive manner in modern healthcare. Then the personalized, after getting all those two things, we can say that we can go for a personalized medicine, where we can assess the causes of disease happening and the reason of disease happening, and how to check those. Okay. Then the participatory, where a holistic approach is being used. We can have the drug, we can have the food, the diet, everything we can have in a proper manner, in a holistic manner. The environmental factors, the lifestyle we have, in a holistic manner, we can go for a participatory a way to have a good medicine to treat our disease, or cure our disease, or manage our disease. So this is the omics for nutrient research, the advances in our knowledge of omics biology. As I told, that we can go for genomics, epigenomics, transcriptomics, what nutrition is being, nutrient is uh, changing the genetic expression level, is being studied in mRNA, omics, then proteomics, then metabolomics. So these are the things we have to go through and know the uh, 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 entire, entire information about an individual, and accordingly we can treat the person. So new directions with AI and Ayurveda. Now, as we told that we have some Nari Pariksha system in there in Ayurveda, where 3 fingers are being used to check your Nari and predict that where there is element or not, in which part of body you have element, and how to treat those elements. So to have those things, there are so many devices being made by so many startup companies, which just take you have to put on your for your artery, horizontal artery on your wrist, and you will get the data uh, processed by artificial intelligence and machine learning in a digital format, where you can get the data where there is what are the different issues and problems happening in your body, and accordingly you can suggest some medicine to treat or cure those diseases. So even India is working uh, at a large scale to make Ayurveda, more easily available, and and validate it scientifically to make sure for its safety and regulate its business. So India is again working on this. Even I think All India Institute for Ayurveda was open in Delhi. So there is all about what I was talking about, the Nadi Pariksha system. So the three fingers symbolizes to study the Vat, Pitta and Kaph doshas. What the machine does, machine just get those all the palpitation, the deeper one and the superficial one, and then process it. After processing, capturing pulse data, processed through AI and machine learning. After processing, just give the insight what is going on inside the body, and then uh, track the patient progress, and then finally a therapy is being suggested to go for. Means it is just to know the where is Vikriti is, where there is Vikriti, and how to go for a harmony, the harmonious. So again, we are talking about the biopiracy. As we are unaware of our own documents, our own Indian knowledge system, so countries, foreign countries or other countries are just taking the benefit of it. And what they are doing is that they are saying ki turmeric, they are just going for patenting turmeric, the basmati rice, the ashwagandha. The properties of all those things are being patented by different countries. There is a case known as turmeric patent case. It happened between 1995 to 97. In 1995, US patent was registered to by mentioning that turmeric has these properties. In 96, a case was filed against it that you can't give patent. It is our ancient traditional medicine, so it is unpatentable. You can patent it. So then in 97, they just accept it and back it. So similarly, there is the neem case, the basmati rice case, the wheat case. There are so many other cases also. So to make our traditional knowledge preserved and stop it from biopiracy, the Indian government has established a TKDL, the Traditional Knowledge Digital Library, which is being translated in different languages, just and shared openly with the databases of some big patent house. Patent officers can assess those data. When we file for a patent about turmeric and any other Ayurvedic formulations, okay, so they just go through it, the database, and they just have the information that the turmeric was already reported for this in Ayurveda or Siddha or Unani or anything else, and so it may help to stop the biopiracy. So TKDL is being supported also by WHO. WHO is also working closely with India. So we are translating Indian medicine from languages like Sanskrit, Arabic, Persian into 5 international languages: English, French, German, Spanish, and Japanese to stop biopiracy. Indian government has also taken CCRAS initiative for this and for the manuscript. And the WHO is also collaborating, where in collaboration with Ministry of Ayush, just to have those all every medicine has to be integrated with the traditional knowledge. So WHO is also working on it. So in recent days, what we are seeing is the internet is full of nutraceuticals. And what nutraceuticals have? It has our ancient wisdom. It has ashwagandha. It has everything, everything what we have in our ancient wisdom. We can say there is nutraceuticals being sold in market at a very large scale, and we are realizing that it is safe. The thing is that there is no safety, no regulation, nothing else available to regulate all those things. So for safety, I can say that nutraceuticals are being used by patients, and for, you can say, dincharya, day-to-day lifestyle. People are using the ashwagandha to for remove stress and all. So we have to go. We have a perception that it has some botanical source, so it is safer. But at the same time, we have to go for it. That companies are making it in a different way, because if we can say that herbs are very limited, and in market it is sold at large scale. So there is a case of SHM. SHM is being mixed with the drug called slimming product, and the SHM is being known for heart attack, stroke, neuropsychiatric, abortion in different part of globe. Like if we talk about heart attack, stroke, it is being reported in USA. Then abortion is reported in Turkey. That by taking this drug, abortion is going to be normal. So by taking all those things in mind, there are some herbal medicine product. You have to make it mark on it, label it. Then the application of good agricultural and collection practices, good manufacturing practices. We have to go for all those things to ensure the safety of the drug we are going to have. So toxicity is associated when taken in excess also. As we know, ati sarvatra barjayet. So patent and regulation, as we told that patents are being filed. Now regulation is also a challenge, because till date, even in Europe, no regulation is there for the nutraceuticals and herb-based product. So there are some things which are required. So labeling, evaluation, registration, sale and suspension should be the part of regulation, where we can label the product that the product has these ingredients. The product has followed the GACP and GMP. The product was evaluated properly. The product has registered for marketing, registered with, let's suppose, the FSSAI or IUS in India, or in other countries like Europe, USA, Japan, Australia. There are organizations for that. So then we can sell it, and then the sale was also should be on proper monitoring. Finally, if we find any flaws, we can go for suspension of that product. So this is all about the ancient wisdom rooted in tradition for modern health. If anyone have any question, please ask. I would like to conclude here. If anyone has any question, we can discuss. Is there any question? Okay, thank you.
थैंक यू सो मच सर फॉर योर एनलाइटिंग वर्ड्स। हमारे पर्यावरण में ऐसी बहुत सारी दुर्लभ जड़ी बूटियां हैं जिन्हें संजोग के रखना हमारा कर्तव्य है, और यह जड़ी बूटियां बहुत सारी बीमारियों का इलाज है। इसी पे मैंने कुछ लाइनें लिखी है जो मैं आप सभी को सुनाना चाहूँगी। प्रकृति हमारी परम हितैषी करते नित उपकार, पर्यावरण स्वच्छ कर देते इनकी रक्षा समय पुकार। पीपल पकड़ी छतुआ नीम सभी पूज्य हमारे, क्यों होने दे इन्हें हताहत यह प्राणों से प्यारे। सखुआ शीशम आम रोपले बड़हर जामुन चंदन, कटहल बरगद और करौंदा नींबू का अभिनंदन। बेल और तुलसी की गाथा सारी दुनिया गाती, कफ पीत और वात रोक ले जड़ी बूटी ही भांति। यह विष पीते अमृत देते रोटी वसन मकान, वन पशुओं को आश्रय देते सबके पूज्य महान।
And now, moving forward, it is my proud privilege to introduce our next distinguished speaker of the day. We have with us Dr. Manik Ghosh, sir, who is an associate professor, Department of Pharmaceutical Science and Technology from Birla Institute of Technology, Mesra, Ranchi, Jharkhand. Dr. Ghosh, sir, is distinguished academician and researcher known for his significant contribution in computational drug discovery, molecular modeling, and pharmaceutical research. The topic is integrating AI-powered molecular modeling with natural products based on drug discovery, from phytochemical virtual screening to ADMET optimization. Honorable dignitaries, ADMET stands for absorption, distribution, metabolism, excretion, and toxicity. So I request Dr. Manik Ghosa to kindly take the stage and enlighten us with his valuable insights. Please, sir.
Okay, thank you for such a nice introduction. Can we move to the slides? Now, there are some student friends are there. Can I ask you what is your specialization? How many of you are from pharmacy background? Okay. And from agriculture background? Apart from pharmacy, which division is here? Biotech. Okay, biotech. Okay, very good. Now, my topic will be simple. It will cover most of the things which we usually do in our day-to-day life, but we never understand that particular thing. We are using AI everywhere. Okay, whatever the things we are doing, either we are using, you can say, Google, we are using Microsoft Office, we are using anything. Everywhere there is AI right now, and we are using them for our day-to-day work. Now, my work is something related to use of phytochemical. As Saurabh sir has just discussed, many of them are being used in modern medicines, etc. So my work is related to that one only. I will show you one example also, which one of your faculty here uh, has already carried out. Piyush, he worked under me and he has carried out a work. I'm going to show you a small bit of that thing also, and how we are using AI on these particular context. Okay, so let us start with the component first one. So what we are going to do, we are going to unlock the nature's pharmacy. Okay, nature's pharmacy means the phytochemicals, the different types of components which are present in the nature, and we are going to utilize them for our own work. Now, don't go through these particular things. The main thing is that the idea behind this particular thing is that the nature is going to give us many things. For example, from willow bark, we are getting aspirin drug. Okay. Similarly, from mold or fungi, we are getting antibiotics like penicillin, etc. Uh, from poppies, we are getting different types of pain relievers. For example, morphine, etc. Okay. So, what are these things? These components are from nature only. Okay, but the main problem of getting anything from the nature is very, very, very dark. Why? Because it is like finding a needle from a haystack. Okay, and if you do not have a metal detector, then the problem aggravates. Okay, none. But right now, AI is like a metal detector which we are using. So we are using the AI tools which is going to detect where that particular component is, and it is going to trace down that particular component, and it is going to show us. Now, normally we are going to say that there may be one this type of needle is present there, but AI is going to tell us maybe it is not one, maybe more than one type of needle may be present there, and we can utilize those things for our work. So how this thing actually works? So initially what we used to do, the older way or the physical way is that we used to take the plant, we used to go for the extraction process by various methods. Then the isolation is the must because we want to isolate the component, synthesize it, or semi-synthetic component, or simply the isolated component can be used as a drug. But most of the time what we are going to get, half of the drugs are getting failures. Okay, it is not so that all of the things which we are getting, it will be acting as a drug. So you can imagine what is the cost we are just including in this particular cases. Okay, so there is a very high cost of these things. Extraction process, isolation process, it is a very costly one. So right now what we are going to do, we are going to scan it through the AI only. We are having digital databases. We are going to scan the component which may be present there and which will be good for our work. Maybe what type of phytoconstituent that can be helpful for what without going for any type of isolation. without going for any type of extraction, etc. processes. Okay, so that is helping, or that is reducing this particular cost, and we are directly going a prediction, and then the success rate is very, very high in this particular cases. One example is that this is the newer one. For example, it is a digital library which is known as the Coconut 2.2. It is a digital library of the all phytoconstituents. You can say it contains more than 4 lakhs different phytoconstituents. Not only for the phytoconstituents, I am not going to say. It contains detailed database of the fungi, etc., marine life sources, etc. Means the chemical constituents which are present in these particular species. And what they have done, they have taken a database, they have created a database of all these type of chemicals which may be present there or which are likely to be present there. And what is the help of these things? You are having a ready-made tool for analysis. Now you take a receptor, you take a chemical receptor, for example, it may be cancer receptor, it may be anti-inflammatory sort of things or inflammatory receptors, and we just want to have a virtual docking. We are going to put this particular chemical and just check virtually only, without going into any synthetic route or without going into lab work. We are not using any animals, we are not using any cell line. Directly we are checking in silico, you can say. And if it is good, then only we will proceed. So this database is helping us in a very good manner. So how we are going to do the virtual screening? So as the database contains a very large amount of the molecule, we are going to screen it. It is a sort of funnel, you can say. We are going to screen it. Now, in the screening, what we are going to do, we are going to screen the molecule through the toxicity filter. Toxicity filter is the major component, because the first thing which we are going to do is to find out whether the component is toxic or not. If it is toxic, obviously we are going to reject it. If it is not, then we are going to take it and utilize it for our homework. Next is the lead likeness. Okay, whether it will be acting as a drug or not. Okay, there are certain criteria. For example, Lipinski rule of 5. There are many type of criteria there. 1 or 2 criteria like Lipinski rule of 5, etc. So you take that particular rule, you place your molecule on based upon those particular rules. If it is falling in, you are going to say that our molecule may be like a drug. We can utilize it like a drug, and we can proceed further. Proceed further. Either you are going to do a semi-synthetic one, or taking that particular drug and directly you are docking it with your component like that one. Okay, simple. So what we are going to take? We are going to take the high potential candidates. So these are the candidates. These are the initial components which may be talked as a heat or leads. And then we are going to work on those particular things. Now, next one after this thing is the docking, which I was talking about. Okay, so what we are going to do, initially there are different types of software. Many softwares are free. For example, Autodock. Okay, this is one of very good software. You can download it, you can utilize it yourself. It is free. SwissDoc, it is available free online. It is online software only. You download the molecule, you are having this online tool, you take the molecule to the receptor and just dock it. It is going to give you a negative score based upon the entropy and going to tell you whether it is fitting to the molecule, fitting to the receptor site in a good manner or not. Now, fitting is very important. Now, normally the docking thing which we used to do with the help of these tools which are present online or the previous one, it is a static docking. Means it is a rigid docking. Your molecule will be treated as a rigid molecule and the receptor is also treated as a rigid receptor. But in our body, that is not that. Both receptors is flexible and the molecule is flexible. So that is a problem which we are facing. So right now we are having another solution with the help of the AI, which is known as the diff dock or the boost. So these type of dockings are making what? Your molecule will be also in flexible mode, the receptor will be in flexible mode, and your ligand will be also in flexible mode. And they are going to bind it together. It will be moving like what is happening in your body. Why? Because the main thing which we want to do that whether it is going to be present at that particular site of action or not. Maybe it is fitting better, it is giving you a good score. But when it is moving, it may split out, it may come out. So that should not be there. So we are going to analyze that thing. So try to understand what we have done. Just going back from 4,000 molecules, we have done toxicity. We are removing maybe 1 lakh molecule, 2 lakh molecule, or maybe 3,50,000 molecule we have removed. We are getting only 50,000 molecule. From there, we are going to find out the lead likeness. What is the lead likeness of those 50,000 molecules? In a particular receptor, we are reducing down to maybe 500 or 300 or 200, like that one. And from there, we are taking only highly potential components. We are going for the next stage. We are going for this docking. We are selecting a specific receptor and we are docking our molecule there and checking whether the molecule is fitting to that particular site in a good manner or not, whether it is going to act on the site or not. But again, the problem is that both of them are rigid. So what we have done, this is the AI thing, diff dock and those two. They are going to give you flexible docking. Both your molecule and this thing will be flexible and you can dock and check that molecule is staying there or not. If it is moving, whether it is coming out or not. That thing we used to do with the molecular simulation, sorry, with simulation studies, which is known as the MD studies, etc., molecular dynamics also, which is also possible. But again, it is a time consuming. A single molecular dynamics, if we are going to do in a normal computer, which we are having, maybe laptop or desktop, it is taking around 1 to 1.5 months. You can imagine 24 hours it is running and it is taking 1 to 1.5 months. In supercomputers also, it is going to take 2 to 3 days for a single prediction, that type of prediction, and that is being reduced down by these type of things. So that is the help of the AI we are getting. Next thing, you have done it. You have identified the molecule. Okay, it may be strong lock, means lock and key sort of things. So it is strongly binding to that particular site. So what we are going to see, either we are going to synthesize it or we are going to test that particular molecule or isolate that particular molecule from the database, and then we are going to utilize for the action. If by chance it is a weak lock, then we have to optimize it. So where it is failing, whether may be possible that some hydrogen bond is missing or some hydrophobic group is there or that is missing. So what we are going to do, we are going to add it and we are going to optimize the molecule. And either it is our chemistry, our knowledge, or we can use AI for that thing also. Okay, we are going to tell the AI molecule that this is the portion where we want a hydrophilic group. It is going to take that molecule and it is going to fit. Maybe it is generating 5, 6, 10 structures. The last one is what? It is unlock, low fit. So we are going to disregard it. So you can imagine from 4 lakh molecule right now we are reaching to 5, 10 molecules only. So this is the case which we used to do for a single type of analysis. Then again 5, 10 molecules we are getting, but whether it is going to work in our body in a proper manner or not. So that is the ADMAT studies. Okay, absorption, distribution, metabolism, excretion, and the main question is the toxicity. Initially, we have gone for the toxicity. It is telling that there is no toxicity, but whenever we are taking inside, maybe that is causing a toxicity. But the modification may be possible that the modification which you have done, that is leading to the toxicity. So we have to understand it, whether the toxicity is there or not. So absorption, getting into the blood, it is very big problem. Maybe it is not absorbed inside the stomach, it is reeling and going outside. For example, many antibiotics are there which are gut specific. They are going to act on the bacteria which are present in the gut only. They are going to kill. So it should not be absorbed. So that is a good thing for them. No? But we want that the component should be absorbed from our body. So again, we have to modify the structure. We have to create it. Second, after absorption, it's distributed. So going to the right spot, I have created a drug. We are taking orally, but it should go to the heart for the action. We are not injecting to the heart. It should go to the heart for the action. So again, we have to take whether it is going to the route, the final destination or not. Now the body is distributing the blood to all of the cases. It is going to the liver, it is going to the kidney, etc. Whether it is depositing there or whether it is having side effect on those particular organs or not, again, it is very important. So that is the toxicity which we are going to talk about. Then the metabolism, whether it is going to survive, because we know that the first pass metabolism is there. Liver is going to do that particular thing. It is going to degrade the drug. So after degradation, what amount of the drug is available for the work? Then excretion, from where it is excreting, stool or from the kidneys, etc. And whether it is going to have a toxic effect or side effect there or not. And last is the overall prediction, overall toxicity, etc. So again, from 5, 10 molecules which we are getting, again, many of the molecules are going to fail here. Try to understand. So this is a very critical drug discovery aspect. This is the thing as I was talking about. If by chance we are getting some bad things, maybe the toxicity enhances, etc. Now we want to do what? We want to modify the molecule. So we are modifying the molecule with help of this toxicity group, etc. We came to know that this one, and we are polishing it. We are polishing the rough things with the help of our AI system. Either with the help of our chemistry, our knowledge of the chemistry, we can do it. But if we are taking help of the AI, it can give us many aspects why it is not so. Now I can tell you one thing. Yesterday only, day before yesterday, I was just going through one prediction tool. It is known as Swiss ADME. You can also just Google search Swiss ADME, you will be getting it. I have given it two molecules. First molecule was aspirin. So aspirin is working on brain. So it is going to tell us that whether it is going to cross blood-brain barrier or not. It is showing that it is crossing blood-brain barrier. It is showing BBB positive, yes. I have taken another molecule, caffeine. It is showing and it is telling that caffeine is not going to permit blood-brain barrier. Now, can you think? It is a prediction, try to understand. It is a prediction that particular component is giving based upon certain calculation that has been given. Swiss ADME is the most versatile tool that is being used and that is being cited by most of the publication. Q1 publication is citing it. Now, it is a very simple molecule which we have given and it is predicting completely different. Then I asked that why that particular thing, I don't know that particular thing. I was thinking it. So I asked this AI why this thing is happening. So it has given me a calculation, and as per the calculation, they are taking about the log P value. Now, log P value of this thing, log P is oil water partition coefficient. Log P value of caffeine is minus 0.07. So it is taking it, it is not lipophilic in nature. So since it is not lipophilic in nature, it is predicting it as it is not going to cross the blood-brain barrier. So these are certain flaws which the AI still have, and we can work together. Obviously, it is not so that it is advanced. We can work. They are not calculating. They are calculating depending upon the diffusion, etc. The active transportation is also happening. They are not taking that particular thing into consideration. Now, it is our duty. We have to understand as a scientist. We have to understand that whether the prediction is 100% correct or not. It is not so that 100% we are going for those particular prediction. This is one of the examples just I want to share. So this is the thing they are making, and we have to understand that this thing is optimized. It is good, but whether it is going to have the toxicity, etc., other parameters or not, done. Next, it is a case study which I have written. It is a true story, and it is of last year only, 2025 only. The first patient dose with the Life 001, which was obtained from fungi, and clinically it is just given. We have predicted it from AI, we have generated it through the AI genomic sequence, and we have given the drug to a patient, and still it is there. Okay. Next is the here what we are going to do. We are going to use a neural network transformation. We are having a digital database of the components, and we are just finding out those things with the use of a transformer languages to translate chemicals into fingerprint. What type of molecule or what type of plant are going to have these things, or vice versa. Maybe we have not predicted or taken a particular plant into analysis, but we can predict that what type of chemical may be present in that particular plant only with the help of the AI, without going into any type of analysis of that plant. It is a prediction, and most of the time it is they have taken that it is around 80 to 90% correct. So it is a very huge leap, you can say. So what is the main thing? The biodigital conversion, which we are going to do in our 2026 plus after this thing. It is the faster. Whatever the things which we are going to do, the analysis with the help of the AI, it is going to be faster compared to the 10-year, which is normally it is the 10-year or more than 10-year for a drug to come into the market. Starting from your preclinical studies to the clinical trials, etc. But the timeline will reduce to 3 years, because already we have done many things, and it is also reducing in many of the cases. Cheaper. Failure happens in silicon chips. So that does not happen, you can say. And we are not going to invest millions of the dollars. That is very, very thing. Greener. Okay, why? Because we are replacing many of the chemical things which we are going for the isolation, etc. Methanol we are using for isolation. Chloroform we are using for isolation. That is not going to be there. Okay, we are just reducing it to that particular manner. So in summary, what we are going to say is that the sources are what? The sources are the natural things, a scaffold in which we are going to build our molecule. We are going to filter them through the library like Coconut 2.2, etc. We are going to refine it with the help of the AI. And obviously, we are going to get a better patient, means the medicine which will be better for our patients. But the ultimate question is that, would you trust a medicine that is designed by the AI? Again, I told you one example. Same thing, it is happening. because we have to modify it. We have to understand that particular thing. As a scientist, it is not so that we are going to give everything to the AI. Now, I've given, usually I give my student assignment. Right now, I'm getting what? They are just simply giving certain things to the AI system, copy pasting it, and submitting it. If I'm going to check the plagiarism, no plagiarism. So, Turnitin is giving the name. Turnitin has just placed it as the AI. They are predicting AI, and it is 100% AI or 80% AI, like that one. So I'm not telling that we are not going to use the AI, but try to understand that the AI is only a tool. And ultimately, we are the scientists. We have to work on this particular field. We have to understand the science. Second, why is nature a better chemist than a human? Obviously, nature, because it is billion years old. Okay, we are just a new species in this particular planet. And last is, what disease should AI solve first? Now, again, it totally depends upon what type of disease we are working on and what is the main thing. I can give you one example. Most of the multinational companies are not working in any disease which are occurring in third world countries. India right now, it is a very developed country. I'm not going to say it is, but earlier it was like a third world countries where disease like malaria, TB were prevailing most. But can you tell me any drug which is given by Pfizer or Glaxo that is being used for malaria, anti-malaria drug? No. Why they will be working on that particular field? It is us who are going to work on this particular field. There are many neglected. Still, till date, they were not working on dengue, chikungunya. But when they came to know that this particular disease happens due to the mosquitoes are born in normal water, they do not require malaria, means mal water or different type of water, then they started working on that thing. So it is us, we have to understand, as an Indian, we have to understand which disease we want to work on and which disease we are going to rely on. Now, I am just giving you a small example which my student has carried out, Piyush Kamlapuri. He is working as an assistant professor here only. So we worked on this two plant, cannabis and dhatura. So these are the main constituent of that particular plant. And what we have done, we have just predicted we have just predicted a target. For example, we just want to know that whether the phytoconstituents are going to work on the breast cancer cell line or not. Okay, so we have taken three receptors, 3-RTSA estrogen receptor, CDK4 receptor, and PARP receptor. Okay, and we try to dock our molecule, which are present in this particular plant only, and try to know that what is the activity of these things. So what we have done, we have gone for a ligand selection, target preparation, and then simulation and the analysis. Everything was done inside the computer only. Nothing. We have not isolated. We have not gone for anything. Okay. And that what we carried out, it validated efficacy of cannabinol against CDK4, okay, and PrEP, and this one as estrogen receptor. Okay. So if we are going to combine, try to understand in future if you want to combine these two things, cannabis and dhatura, the component of these two, and try to work on this particular type of cancer, then obviously maybe we are going to get a very good cancer, anti-cancer drug out of it. Okay. So this way the AI or this way the system is working. This way we are. This is a live example which we have carried out. Okay. Thank you. Any query, any questions? Yes, any query, any questions? No questions. So two things can happen. Either you have understood everything or nothing. No, I will just ask you, you please go through these in internet. You go through different AI tools, try to find out different type of components which we are. Okay. Okay. Thank you all.
Thank you so much, sir, for your valuable insights.
Let's take a moment and welcome our esteemed guests, Dr. Raj Shekhar Prasad, sir, Executive Director, JCSTI, and Mr. Priya Ranjan, sir, Technical Officer, JCSTI. Sir, please come up on the stage, sir. Now, I would request Dr. Manish Majumdar, sir. Now I would request Dr. K. Rajeshwar Dutt, sir, Principal and Dean of FMSR, to kindly felicitate Dr. Raj Shekhar Prasad, sir. Now I would request Ashok Kumar, sir, Dean Research, to kindly felicitate Mr. Priyaranjan, sir.
Now I once again request Dr. Rajsekhar Prasad sir and Mr. Priyajanjan sir from JCSTI to kindly come upon the stage and provide the certificates to both our speakers, that is Dr. Mani Ghosh sir and Dr. Satyajit sir. I also request both the speakers to kindly come upon the stage to receive their certificates. Thank you so much, sir. It was an honor to have you all here. Thank you so much again.
Now everyone please proceed for lunch.
If you were born between 1980 and 2000, तो एक्सिस मैक्स लाइव लाया है एक
भी आएगा, दिखाओ जितना भी। मैंने जितना भी, मैंने 5 लाख बोला, मैं तो ढोल बजाने वाले को ही अभी से बुक कर लिया 17 मार्च के लिए कि भाई ढोल बजाने जब आएंगे मैंने करेंगे। वही बोला, मैं बुक कर लिए, पैसा दे देना, मेरा पैसा होगा तो सेल्फ नाटी कराते हुए ऊपर लेके चलेंगे। चिंता क्यों करते हो आप? मस्त नाटी आ गई और वो भी बजवा देंगे, ढंग ढंग ढंग, एनसीसी का बैंड। लेकिन ये है कि भाई तुम्हारी सीसी की मीटिंग कब होगी जिसमें हमारा अप्रूवल आएगा? मेन बात तो ये है, सीसी की मीटिंग। सर सीसी की मीटिंग का वो ध्यान रखना उसमें। मंचल को बोल देते हैं, कुत्ते हैं ना, ज्यादा बोलेंगे तो पैसे मांगेंगे। इस वजह से गोपाल को ऐसे ही बोला, मैंने ध्यान रखा। सीसी की 20 मिनट इंस्पेक्शन तो गया, लेकिन सीसी की मीटिंग का देख लें तो पोर्टल फिर से खोल गए। हाँ यार, क्या चक्कर है? अरे कोर्ट का डिसीजन हुआ, कौन से कोर्ट का डिसीजन? अरे लोगों ने लगा दिया होगा ना, फॉर्म नहीं भरे होंगे ना बहुत सारे। वही तो एमएलए वाले बोल रहा, मैंने तो अगले साले बड़ी मुश्किल से खुलवाया तेरा पोर्टल। और करवल सिंह को मैंने सर बहुत मुश्किल से खुलवाया, ये खुश हो गया। मैं आज ही बोलता हूँ, मैंने हाँ बोल कितने 17 कितने मार्च तक खुला है? 26 फरवरी तक। 26 फरवरी या मार्च? 26 मजूमदार जी कहाँ गए? मैंने कहा उनका लेक्चर, उनकी कॉन्फ्रेंस में लेक्चर था ना आज। अच्छा, एक बार सर वो देंगे 3 सर्टिफिकेट, वो कर ले, फ्रेम कर ले। क्या हुआ
सर? कल हॉस्पिटल जाना है ससुर को लेकर।
ये कैंटीन में साइन तो कराओ किसी।
किसके करवा?
ड्यूटी नहीं है क्या आपकी? कल ड्यूटी नहीं है?
मशीन कौन चलाएगा? तो
चलाएगा जिसको ड्यूटी देके जाओ, उस लड़की को बुलाओ नीचे।
लाजवाब।
हाँ बिल्कुल, ये बिना ड्यूटी के थोड़ी करता। और ऑफिस क्या देखेगा? एमडी साहब अगर किसी दिन हाथ लगे तो वजह इसका काम ही नहीं है, तो फिर आपने रखा ही क्यों? नहीं सर, इसकी ड्यूटी नहीं है, तो ड्यूटी नहीं है तो फिर ये करती क्या है?
कौन?
एमडी साहब अगर इसको देखेंगे तो क्या कहेंगे? बता।
नहीं मतलब उनको उनकी ड्यूटी लगानी है।
उसकी लगाओ, उसको सिखाओ भाई तेरे को कल ड्यूटी करनी है मेरी वाली।
सिखाए तो है।
हाँ तो बुलाओ उसको, उसके साइन भी करो। अच्छा, तुमने कपड़े के पैसे दिए थे ना एक बार कुछ मैडम?
दे दिए आपने मेरे को 100 रुपया।
पक्का दे दिए थे ना?
दे दिए।
हाँ बैग
दे दिए। क्या मंगला भाभी को बोलूं फिर उनके साइन करवा दो?
नहीं, उस लड़की के करा, और वो भी रखेगी हिसाब पूरा
लिख के।
क्यों? मशीन चलाना आता तो है उसको, तो बस उसको सिखा दे।
चलाया था उसने तो।
हाँ तो बुला लिया अभी।
मेरा नंबर नहीं है।
मैं बुला रहा हूँ।
फिर फाइल्स तो दे दी, फाइल्स तो मैं ही दूंगी फिर आके ना।
कौन सा फाइल लेने आई रहेगा?
बच्चे चले हुए हैं एक एक दो।
तो उसको समझा देना।
नहीं
20 फाइल पकड़ा जा, 20 का हिसाब ले लेना उसको।
फाइल्स में खुद ही कर लूंगी मैंने।
आपको बोल देना कल।
आप जिस व्यक्ति को कॉल कर रहे हैं
बुला ले और न्यू करी, वो न्यू उठा रहे हैं।
ये नहीं, यही करवाते हैं सर।
हेलो, अरे वो लाजवंती को भेजना नीचे। मंडे को इंस्पेक्शन है ना, मालूम है? किस चीज का? डॉक्टर हो के तुम ऐसे बोल रहे हो तो क्या जिम्मेदारी बनती है?
सर मैंने एक और बात कही थी आपसे। तो मैं गई थी डॉक्टर के पास, तो मैंने चेक कराया तो मेरे को दालें बिल्कुल मना है।
क्या?
दाल सारी की सारी। तो उसमें जैसे मेरे को कैप्सिकम हो गया, दाल होगी, ओट्स हो गए, लेमन, फिर इलायची,
गरम करने वाली
प्रॉपर एलर्जी हुई है। अब उन्होंने डॉक्टर ने तो यही बोला कि परमानेंटली बंद करनी पड़ेगी लाइफ टाइम। नहीं नहीं, मेरे को ये दूसरी तीसरी बार बढ़ेगा और मेरे ना पैचेस बढ़ते जाते हैं एक्चुअली।
यार होम्योपैथी का
होम्योपैथी का सर मैं ले लूँ?
एक होम्योपैथी का नंबर 1 डॉक्टर मैं तेरे को शेयर कर।
हाँ जी, लेकिन अगर ना बड़े शॉर्ट नोटिस पे दोबारा हो गया।
कोई बात नहीं, ये डॉक्टर अर्पित चोपड़ा
ठीक है,
होम्योपैथी का ना भारत रत्न वगैरह सब मिला हुआ।
ठीक है।
डॉक्टर एनएस आशा है।
ठीक है सर। तो फिर मैंने बस ये बोला था कि मैं ना दोपहर को दाल नहीं खा सकती। फिर शेरा को क्या वो बनाता नहीं है, फिर ऐसे सब्जी और वो चपाती दे।
तो यार इससे ठीक है, ये तुम सवेरे ब्रेकफास्ट में जो बनाते हो वो सब दो ना।
All right, thank you. Appreciate. Please.
Hello.
Afroz sir, are we audible to you? Afroz sir? हाँ प्लीज। ये कहाँ से कॉल आ रहा है ये? थैंक यू थैंक यू। लगाने की जगह है कहीं? चार्ज पे डालना फोन। फोन दे रहा हूँ।
हेलो। आपकी स्लाइड्स तो आ रही है, आपकी आवाज नहीं आ पा रही है।
नहीं सर का म्यूट है, जब तक म्यूट नहीं हटाएंगे। हाँ सर म्यूटेड है। सर आर वी ऑडिबल टू यू?
Hello.
Can you hear
me?
us sir?
Hello.
Yes, Afroz sir, your voice is audible here. Are we audible to you? पूछो उनको कि आवाज यहाँ से जा रही है कि नहीं।
Yeah, I can hear you very well. Yeah, I can hear you very well. Yeah, I can hear you very well. Yeah. Not from the phone, sir, from Zoho. No, not from Zoho actually.
हमारी आवाज नहीं जाएगी, दिक्कत है।
हमारी आवाज सुनने की क्या जरूरत है?
ये तो उनका है।
Yeah, now I can hear you very well.
हाँ करवा रहे हैं सर, बच्चों को म्यूट अनम्यूट कर दीजिए। सर
Very audible. Please go ahead. You have only. All right. Thank you so much. Everything is clear, sir. Thank you so much. I appreciate it. All right. Thank you. All right, sir. Thank you so much.
Have you joined?
Yeah.
Right. Trolls.
All right. Distinguished guest, Honorable Vice Chancellor of Sai Nath University, the Professor Dr. S.P. Agarwal, my mentor, Dr. Brinda Goswami. Ladies and gentlemen, good afternoon, everyone. It's always great to be at Sai Nath University. The reason whatever I am today, big goes to this place. So it's always great to be here and always great to be a part of a success journey of this institution. I would like to thank Sai Nath University for giving the platform to share some insights about recent advancement in herbal medicines in modern healthcare system. My name is Dr. Muhammad Afroz. I am head of the Department of Business Analytics and Management Department at Prince Mokhtar University in Saudi Arabia. I have several publications regarding to medical domain that has been my actually core domain, that is IOMT, Internet of Medical Thing, that is my domain. Today I will be sharing some insights on recent advancement in herbal medicine in modern healthcare system with a special focus on India's remarkable journey in global perspectives. This is a particularly exciting time for herbal medicine as we witness the convergence of ancient wisdom with cutting-edge technologies. During limitation of the time, I will try to finish it as soon as possible. So, if you go further to my next slide, you can see here the global market of herbal medicine is growing too fast, and India itself is, if we look here, is truly reaching quite far. So the global herbal medicine market has reached around $195 billion in just 2025. And what is remarkable is that India, the position in this landscape is quite good. India is leading in the world with the fastest growing rate of 16.8 CAGR. That is the highest CAGR in the world. And if you see over more details, we have around 800,000 plus practitioners with 3,400 Ayush hospitals, 9,000 manufacturing facilities, and we export to around 150 countries to the world, and that is around 4.6 billion. So, if you see the WHO Global Center, the India is the center of that one. So, these numbers actually show that. The Ministry of Ayush has clearly shown that India is not just participating in herbal medicine, but actually it revolutionizing it. So we are leading actually. If you look at the Ayush system, and this is something which makes India very unique. Okay, it has almost 5,000 years of accumulated wisdom and practical healthcare knowledge. Ayush stands for Ayurveda, Yoga and Naturopathy, Unani, Siddha, and Homeopathy. These are not just alternative medicines, what we think. They actually represent the whole healthcare philosophies that have served billions of people across the multiple generations. What is remarkable is that while the world is now discovering the value of herbal and traditional medicine, India has been actually perfectly using these systems for millennia. We are now witnessing a beautiful convergence where this ancient wisdom will meet actually modern scientific validation and technological advancement. So if you look here, we have a so rich system in terms of hospitals and colleges, Ayurveda, Unani, Siddha, homeopathy, and the government itself is supporting the naturopathy quite well. If we move further, this is something which is my domain, and which I believe that in the coming years, the technological revolution of Internet of Medical Things, artificial intelligence, blockchain, and big data will revolutionize the way the herbal medicine has been in practice. Four major technologies will actually transform and shape up how we develop, we validate, and deliver herbal medicines. First, it will be Internet of Medical Thing, IoT. It is an $8.2 billion market growing around 28% annually. We are using smart sensors and real-time monitoring systems that can achieve up to 99% of accuracy in terms of quality control and patient monitoring. Second, AI and ML. This is nothing new. All of us know about AI and ML. Artificial intelligence and machine learning. It's a $15.4 billion market, expecting up to 42% of annual growth. So AI is making actually drug discovery 75% faster, achieving around 87% accuracy in diagnosis. It means that we can now scientifically validate traditional formulations such with more efficiency. So we have a huge sort of experience, and with the help of an AI and ML, we can validate those scientifically. Third comes as a blockchain. The blockchain technology, which is valued up to 3.8 billion, and if you look at from the security perspective, the CAGR has gone up to 65%. And because everyone is concerned about security these days, blockchain has reduced the counterfeit medicines by 90% and provide 100% traceability from farm to pharmacy. So the way it has been taken those raw materials all the way through the market, through the store, where we see it has all the records, and the blockchain, as you all know, the ledger cannot be manipulated. So it helps us in 100% traceability. This is actually very crucial in terms of maintaining the integrity of herbal supply chain. And the fourth one, which we all talk about, that is a big data that has a market value of around $12.1 billion, and it has a CAGR of around 31%. We are analyzing over 15 million patient records to generate real world evidence for herbal medicine effectiveness. So with the combination of all those technologies, investment in herbal medicine has reached that is very pleasant to see, actually around $39.5 billion by 2025, and it is growing around 35% annually. So this is not just a evolution. I will say it's a revolution, actually, the way it has been. The technology has been changing. My next slide will be about digital Ayush. We all talk about Ayush, so I will talk a bit about the digital Ayush. India actually has been at the forefront of digital transformation through our digital Ayush initiatives. The Ayush grid has digitized over 15 million patient records, creating a massive knowledge base for research and treatment optimization. The e-Aushadhi platform has brought almost 9,000 manufacturers online, ensuring transparent and quality in productions. The Ayush Sanjeevani application has been downloaded around 8.5 million times, bringing herbal healthcare directly to the people mobile of yours and mine. The government has been supporting these initiatives really well. They have invested around 4,000 crore rupees, that is around $480 million in these digital initiatives. The result speaks for themselves. We have now around 2,100 Ayush tech startups, and those numbers are really fascinating. And think about these numbers. The startups have attracted around 850 million of venture capital funding between 2020 and 2025. So within 5 years, they have gained almost 850 million venture funding. We are also creating around 500,000 jobs per year. I think this is target, but I'm sure that we are going to reach very soon. Uh, and exporting to around 150 plus countries. So India has truly become the global hub for technology-enabled herbal medicine. So if you look here, these are some names and revenues and the technologies and the impact. If you can see that Patanjali, Dabur, Himalaya, and other startups, the revenue they have been getting, the technologies they have already started to use. And if you can see in general, we can say that we have a huge number of impact in terms of alternative medicines as well job security. So this comes all through with the vision of the Honorable Prime Minister. Mr. Narendra Modi, he has been very vocal for this type of technologies, actually. And if you see global best practices, I have just mentioned some of them here as well because I have been living here for past quite some time. So if you look in India, our Ayush system has almost 18.1 billion market, okay, with a CAGR of around 16.8%. Supported by 3,400 hospitals and 800,000 practitioners. And we are the WHO Global Center, the fastest growing market. If you look at the China, they have a market, a value of 60 billion, but the CAGR is quite different. You can see India has been at 16.8% CAGR, but China has been just achieving 9% CAGR. And if we talk about Saudi Arabia has been funding a lot of money these days, actually, in terms of these alternative medicines. So they have a vision 2030, and they have allocated a fund of $850 million, and they also expect to reach a CAGR around 18%. They have MOH application, which has around 12 million users, and 85% digital health adoption target, and they intend to invest around 64 billion in healthcare investments. Uh, with all those, there are some challenges. Of course, nothing comes without some challenges. If you look at the challenges, I would like to be really transparent about something. The herbal medicine industry faces some significant challenges. First of all, we talk about the quality standardization. We don't have a really standardized quality for the herbal medicines which are produced on different levels. Once we talk about those big names like Patanjali and Dabur and others, and then we talk about the local manufacturers. So we have to come to bring all those within some sort of framework so that we can have a quite quality standardization. Scientific validations, we need to make sure that the research, the medicines we produce, they are scientifically proven, and as we discussed earlier, with the help of AI and ML and blockchain, we can validate those results very well. Regulatory harmonizations, there must be, I'm sure that government is working on this, and there are some frameworks, but we need also to make sure that it is very clear and very evident about the regulatory harmonization. Supply chain integrity, we need to really improve the supply chain so that these herbal medicines can be easily exported to the worldwide. And public awareness, this is the one of the key and social challenges we face, that still, despite we being the leader in um, this type of medicine, we still lack some public awareness, and we believe on some the other type of medications. But the good news is that technology is actually addressing every single one of these challenges with proven measurable results. AI can provide quality control. Blockchain ensures the supply chain transparency. IoMT enable evidence-based practice. Big data supports regulatory framework approval, and digital platform build the consumer trust. So the solutions are not theoretical; they are being actually implemented successfully right now, as we have seen in the examples from India, China, and Saudi Arabia. So if you look at the future vision, I am quite evident, quite clear that by 2030, India aims to achieve a $50 billion market size with $8 billion in annual export. We are targeting 50% integration between Ayush and modern medicine, completing around 5,000 clinical trials, creating 2 million jobs, and serving 500 million patients globally. This actually needs some investment, I'm sure, huge investment, and that is around 10,000 crore investment. And globally, we will see different waves of innovation by 2026, 27, just starting now. We will see genomic personalization for herbal medicines. This is something, a new topic. Actually, I'm working on this subject as well. That is genomic personalization of treatments. AI chatbots with around 95% accuracy for patient consultations. 5G enabled IoMT network for real-time monitoring. And by 2028, 2030, I'm sure that we will have nano encapsulation for better bioavailability, quantum computing for molecular modeling, and VR AR system for practitioner training. And we hope, and I'm quite sure about that, by 2031 to 2035, in next 10 years, we will see AI will design entirely new herbal compound, true precision medicine based on the specific need of the patient, based on individual genomics, and even bioprinting for the herbal extracts. So if you look at the key takeaways, we India, if you see here, if let me summarize, I know I'm running short of my time, so I will try to finish it just within 2 minutes. I have highlighted 8 key takeaways. The global herbal medicine market is growing from $195 billion in 2025 to reach by 2030 around 350 billion, around 12.5% CAGR. Second, India leads with number one growth around 18.5 billion market and 16.8% CAGR, and over 800,000 practitioners and WHO Global Center right here. Third, four key technologies are driving transformation: IoT at 8.2 billion, AI at 15.4 billion, blockchain at 3.8 billion, and big data at 12.1 billion. Fourth, if we talk about Indian success, Indian companies are succeeding massively. Patanjali has reached around 30,000 crore rupees. Dabur has a market share of around 11,500 crore rupees, and with around 2,100 startups raising around 800 million in funds. And fifth one is about digital Ayush. I'm sure that the infrastructure, the way it has been made, we have 50 million plus records, and e-Aushadhi, we have now 9,000 manufacturers. And global India is leaders. If you can see, India the fastest growing, and we have solutions for the challenges. We have AI for quality, blockchain for less counterfeit, and IoT for better performance. So by 2030, me as an Indian, I would like to see these numbers be quite real. India reaches 50 billion market with 8 billion exports, 2 million jobs secured, and global herbal medicine hub. So that's it from my side. It was really nice talking to you all, and right now we are stand at a quite unique momentum in the history, where 5,000 years of herbal medicine wisdom meets with 21st century technology. India, with its Ayush system, is uniquely positioned to lead this global transformation. I want to thank once again Sai Nath University for organizing this important conference and for giving me this platform to share these insights. I am open for any collaboration, research, technology transfer, academic exchange, or industry partnership. Whether you are a researcher, entrepreneur, academician, or healthcare professionals, there are tremendous opportunities for collaboration between India and Saudi Arabia and the global community. Thank you once again, and धन्यवाद, शुक्र लकम.
थैंक यू सो मच सर। मैं साईनाथ यूनिवर्सिटी की तरफ से आपका तहे दिल से शुक्रिया अदा करना चाहूँगी। और आज हम सब बहुत सौभाग्यशाली हैं कि आपने अपना इतना कीमती वक्त हमें दिया। सो थैंक यू सो मच सर, थैंक्स अ लॉट।
So kind of you. Thank you so much.
No, one second, sir. First, I have to check the date on screen sharing. Okay. Sir. It's sharing, sir. It's coming on.
Yes, sir. You are audible. Are we audible to you?
Hello.
Yes.
अब हमारे साथ ऑनलाइन माध्यम से जुड़ रहे हैं प्रोफेसर डॉक्टर कौशिक नंदा दत्ता सर, डिपार्टमेंट ऑफ फार्माकोग्नोसी, NETES इंस्टीट्यूट ऑफ
Sir, it's coming
फार्मास्यूटिकल
sharing
साइंसेस,
screen has
मिर्जा
failed.
गुवाहाटी, असम। प्रोफेसर दत्ता सर हर्बल मेडिसिन और फार्माकोग्नोसी के क्षेत्र में एक प्रतिष्ठित शिक्षाविद एवं शोधकर्ता हैं।
One second, sir. So we have to download the Zoho meeting launcher. Hello. Yes. नहीं, स्क्रीन शेयरिंग नहीं हो रहा है, यहाँ पे दिखा रहा है आपका फेल दिखा रहा है। नहीं, वही कर रहा हूँ, लेकिन यहाँ पे तो आपका नहीं दिखा रहा है। Hello. Sir, I am audible.
Yes, sir. You are audible.
अभी मैं शेयर किया था, आपको मिला था? हेलो।
हेलो,
आप एक बार चेक कीजिए ना।
आपका स्लाइड्स यहाँ से चला रहे हैं।
नहीं, मैं यहाँ से कर रहा हूँ, आपको दिख रहा है?
हेलो,
अभी आप एक बार देखिए ना, मैं अभी शेयर कर रहा हूँ।
all the chairpersons, all the chairpersons are informed that they're required to prepare a summary of whatever the speakers are presenting or delivering, and that summary with feedback needs to be submitted to Honorable Vice Chancellor's office. I repeat, all the chairpersons, मैम मैम आप भी चेयरपर्सन हैं, सभी चेयरपर्सन्स को सूचित किया जा रहा है कि जो भी यहाँ से स्पीकर्स बोल रहे हैं वो क्या बोल रहे हैं उसका एक समरी बना लीजिएगा और साथ में आपका फीडबैक, और ये कुलपति महोदय के कार्यालय में जमा किया जाएगा। धन्यवाद।
Hello. I'm audible. I'm audible, sir.
Yes, sir, you are audible. Kindly start.
Okay, okay. Start, sir.
Hello. Sir, you can please start.
Can I start now? Hello, sir. We can start now. Hello. Yeah. नहीं अभी मैं स्टार्ट कर सकता हूँ ना मैं इसलिए पूछ रहा था कोई रिप्लाई नहीं है ना ओके ओके Good afternoon, everyone. Our respected Vice Chancellor, Sir of Sai Nath University, all the official speakers for the conference, all the esteemed delegates, and all the participants who have joined in this conference. Myself, Dr. Kaushik Nandan Datta. I am working as a associate professor in Department of Pharmacognosy in the MCAR Group of Institution. First of all, thank you so much for this opportunity. First of all, in your conference from traditional knowledge to modern therapeutics, translational advance is herbal medicine. We all know that for thousands of years, herbal medicine has served as the foundation of healthcare system in across our civilization. Yet today we stand a transformation moment where ethnomedicinal wisdom meets the molecular biology. We all know after COVID-19, the demanding of herbal medicine is very high. And first of all, thank you so much for organizing this type of conference. Okay, next slide, please. We all know about the herbal remedies. In herbal remedies remains the primary healthcare choice for billion worldwide, particularly in developing nations, where access to the conventional. We all know that herbal medicine has started from the ancient times. We all know that demanding of herbal medicine is very high in case of Ayurveda also. In case of Chinese medicine also, the demanding of herbal medicine is very high in case of Chinese medicine also. We all know about the Hotenia cordata. It is a very common plant in our India also. In Hotenia cordata is the uses of Hotenia cordata in Chinese medicine is very high. And next slide, please. In your seminar, the topic translation research, because we all know that herbal medicine having the some advantages and some disadvantages also. Because herbal medicine contain different type of chemical constituent. We all know about the chemical constituent. Like in case of example, like cincuna is a very common plant, is a malarial plant, anti-malarial plant. Cincuna contains quinine. Quinine is a very nowadays also cincuna is a very famous drug as a anti-malarial drug. But except cincuna, different other chemical constituents are also there. But whenever we isolating the chemical constituent, it means it takes so much time. That's why nowadays different methods are there, and different methods are there. That method are very much useful for the isolating the compounded. In case of because I am from the Northeast India, Northeast India is globally recognized for the your biodiversity hotspot. Indigenous communities of the region possesses the rich ethnomedicinal heritage, relying on the plant-based remedies for wound healing and inflammation. Nowadays also, in Northeast India, different traditional healers are available. That traditional healer mainly gives the medicine for the wound healing, inflammation, etc. And traditional knowledge system nowadays, because in recently we all know about the Indian knowledge system. Yeah, traditional knowledge system is the only one part of Indian knowledge system. As an Indian knowledge system, provide the valuable leads for the drug discovery, yet many remedies remain scientifically unexplored and unstandardized. Next slide, please. Next slide. See, we all know about the adulteration because quality control and standardization is a very complex term in case of your herbal medicine. Because in case of our synthetic medicine, it is very much easy to purify the compound. But in case of herbal medicine, to purify the compound, it takes time and it takes different types of technique also. And another one problem is the stability problem. We all know about the whenever we producing any type of herbal medicine. In case of herbal medicine, the main side effect is your stability, because after 2 to 3 days or after 1 month, some microorganism will affect that herbal medicine. That's why it is very much risky to producing the herbal medicine in case of our normal lifestyle. Next slide, please. Okay. In this topic, actually, today I only give a little bit information about what type of herbal study or what type of traditional knowledge regarding the modern therapeutic, regarding the herbal medicine, what type of research we carried out in our laboratory. Because in our college, we are having one specific pharmacognosy laboratory. In our laboratory, what type of study we have performed in last 6 months. Today, I only explore this type of thing only. Next slide, please. This is the first paper. It is our research paper recently published on one journal. That journal name is Explore. Explore journal impact factor is more than 2. And in this paper, actually, it is a very interesting paper. In our Assam, because I am basically from Assam, that's why we have studied this paper. Because in our Assam is famous for Bihu. In Bihu time, we have one tradition is there. We have eaten 101 number of leafy vegetable as a subsi, or as a means we can eat with rice in the during Bihu days. For this paper, we have collected 101 number of plant from your different parts of our Assam, and we have collected all the plant, we have authenticated all the plant, we have hydrochemically screening all the plant, which type of secondary metabolite are generally, what type of secondary metabolite are present in this plant, and what type of activity they are what type of activity means they are having. We have studied all these things about 101 plant. And another one thing, this 10 plant, this tradition is a very means what is called very unique tradition, because in any part of the India, 101 leafy vegetable, consuming 101 leafy vegetable is not there in any part of the world except Assam. Next slide, please. Okay, in this slide, we have seen one graphical abstract that we have collected all the plant, we have prepared as a subsi, and we have culinary preparation is there, and we have taken that, and we have survey conducted by 117 number of participants, 117 participants. And next slide, please. These are some pictures of plant what we have collected from different sources. And so it is not very much easy to collect 101 number of plant from different species. Okay, next. Another one research, it is a very interesting research, because generally, because Assam or Northeast is famous for the lemon, because in Assam, different types of lemons are available. We have isolated the oil from the lemon peel. It is very interesting, because generally, the other parts, the lemon oil mainly they'll isolating from the inner portion of the fruit, but we have isolated from the pulp of the lemon. It is, and we have performed the GCMS study, and after performing GCMS study, we got different numbers of your chemical constituent. And when we perform the antimicrobial activity, that it is very much interesting that the amoxicillin, because it's a common antibiotic, the result is somewhat similar with the amoxicillin antibiotic. You can imagine the oil which are contained in the pulp of the lemon. It is means giving the same type of effect like as the amoxicillin. Next slide, please. We have performed I already told, we have performed the GCMS study, we have performed the molecular docking, we have performed the molecular dynamics also. And after molecular dynamics study, we got to know that this plant, this oil having the very good number of your chemical constituent which having the very good antimicrobial activity. We have already published this journal, published this paper in one journal from our department. Next slide, please, sir. This is third paper we have published regarding same like us, but in this case we have lemon is different, because lemon is different means in Northeast more than 20 numbers of lemons are available, because whenever we go to the outside of the Northeast, then we only seen the only 1 or 2 numbers of lemon species are available. But in our Northeast, more than 20 numbers of lemons are available. Till now, we have completed more than 10 numbers of lemons in case of antimicrobial activity, and we have we have already preparing one type of your spray, antimicrobial spray already we have performing, and we have submitted for patent also. And this also, this research also, we have isolated the oil from the lemon peel, and I already told we have performed the GCMS activity. And in GCMS activity, we have seen different numbers of chemical constituent, and both the oils have a very good number of your antimicrobial activity. Next slide, please. Here also we have seen different what is called molecular docking study and molecular docking, and also we have simultaneously performed the molecular dynamics also. And in that cases, we have seen that the oil containing from the lemon having the very good number of your antimicrobial activity. Okay, next slide, please. This is a very interesting research paper, because the name of the plant is your Pogostomon bengalensis, and the name of the plant, what is in Assamese, it is known as Sukloti. Sukloti means which reduce the inflammation. From the name itself, it is a very good number of what is called anti-inflammatory activity, or from the wound healing also. And we have actually isolated the, we have I will do one thing. I've seen we have prepared this type of one patches from this plant, and this patches is looks like as a what we have using the belladonna plaster in market. Belladonna plasters are available. Same way, we have isolated the chemical constituent, and we have produced, or we have what is called, we have prepared one type of this type of pets. This type of pets we have prepared from the this plant, and already we have applied for the patent also for these pets. Next slide, please. This is another one research paper we have recently published. This research paper is regarding the oil, regarding from the chili. Chili, because we all know Northeast is famous from the chili also. And chili means we have taken 3 types of chili, and we have performed the your extraction, we have performed the GCMS activity, we have performed the molecular docking, we have performed the molecular dynamic study, we have performed the antimicrobial activity, and we have seen that the chili also having a very good number of antimicrobial activity. Next slide, please, sir. Here, next slide, please, sir. Next slide, we have seen the different numbers of 3D and 2D and 3D structures for the your antimicrobial activity. Okay, next, another one slide, another one paper. This paper is very much interesting, because this paper we have published in what is called biomedical chromatography. And interestingly, in this paper, our principal sir of Sai Nath University, Monish Majumdar sir, is also one of our co-author. And this we have isolated the capsaicin from the Nagasili, because we all know that Nagasili is mainly available in Northeast part, because in Nagasili contain the capsaicin. We have isolated the capsaicin from the Nagasili study, and we have purified the Nagasili by using the HPLC chromatography. Next slide, please. And this is on the last research paper we have recently published. This is one skin irritant plant that is known as Dendrocyte cyanota, because we all know that skin irritant plant also, it helps in our wound healing, it helps in our inflammation. For this purpose, we have performed this one, what is called Dendrocyte cyanota. Then Dendrocyte cyanota, we have performed the antioxidant activity, we have performed the FTIR, we have performed the GCMS analysis, we have performed the ADME, we have performed the antioxidant activity also. Okay, next. These are some the recent diagram. What is after GCMS study? How we what are the component found? What are the GCMS? These are one diagram of GCMS spectra. And in next slide, some we'll go for some molecular docking. These are some molecular docking structure. Next slide, please. Sir. This is our actually our one what type of actually perform what type of study we generally perform in our laboratory. We have performed the extraction, we have performed the extractive value, we will perform the microscopy, we have performed the phytochemical analysis, we will perform the your S value, we have performed the column chromatography because column chromatography is a very interesting technique by because we all know whenever I already told one example that capsaicin contain sorry, chili contain the capsaicin, but chili also contain dihydrocapsaicin. How we isolating the capsaicin from your that mixture by using the column chromatography. That's why. Then we estimation the TLC estimation of HPTLC estimation by HPLC method. These are the some and we perform the in vivo activity also. Next slide, please. Sir. These are the some research activity performed by my scholars. They will perform the different one of they have performed the cardioprotective activity. They have performed the wound healing activity. Mainly in my guide in my research, uh, our group will mainly perform the wound healing and will mainly perform the cardioprotective and will perform the oil different characteristic of oil. Next. Today, another very interesting topic. We have prepared one biosurfactant from the garage. We have performed a silver nanoparticle. That biosurfactant we have collected from one type of garage. Garage means where our cars or scooters are servicing. From that purpose, we have one oil spill degrading bacteria we have collected from that area. And recently, we have communicated this paper also. This is a very interesting topic. Next slide, please. Sir. This is all about your today's my presentation. Thank you for your attention and engagement. If you have having any query, you can ask, or if you have any guidance for your any research activity, or then I am with you. And thank you especially for Monish Majumdar sir. Thank you so much for inviting me for this beautiful seminar. And thank you all the management of Sai Nath University. Thank you so much.
सर, आपने अपने विद्वतापूर्ण विचारों से इस सम्मेलन की शैक्षणिक गरिमा को और समृद्ध किया। इसके लिए मैं आपका तहे दिल से आभार करती हूँ। धन्यवाद सर।
Thank you so much. Thank you so much.
So, a quick couple of announcements. All the students who are participating in the poster presentation can move towards their respective posters, and all the judges are also requested to move along. जितने भी छात्र और छात्राएं पोस्टर प्रेजेंटेशन कर रहे हैं उनसे अनुरोध है कि वो अपने पोस्टर के पास प्रस्थान करें और जजेस से भी अनुरोध है कि वो उनके साथ जाएं। धन्यवाद।
अब हम तकनीकी सत्र को आगे बढ़ाते हुए हमारे अगले स्पीकर जो ऑनलाइन माध्यम से हमारे साथ जुड़ रहे हैं, डॉक्टर महेंद्र सिंह अशावत सर, डायरेक्टर कम प्रिंसिपल लॉरिएट इंस्टीट्यूट ऑफ फार्मेसी, HP टेक्निकल यूनिवर्सिटी फार्मा साइंस रिसर्च सेंटर, कांगड़ा, हिमाचल प्रदेश, प्रोफेसर अशावत सर फार्मास्यूटिकल्स एवं हर्बल ड्रग डेवलपमेंट के क्षेत्र में एक सुप्रसिद्ध विशेषज्ञ हैं।
ऑन है, आप मेरे को बताइए ना, यहाँ से स्लाइड शेयर नहीं करना है
सर। यहाँ आप वहां से शेयर स्क्रीन कर सकते हैं तो।
हाँ, मैं शेयर स्क्रीन कर देता हूँ ना आपको, दैट विल बी बेटर है ना। हाँ, ये देखिए मैं शेयर कर रहा हूँ। इज दिस नाउ विजिबल?
हाँ सर,
विजिबल है?
हाँ सर, फुल स्क्रीन, यू कैन बिगिन योर स्लाइड शो।
नहीं, इस पे आप देख पा रहे हैं मेरी स्लाइड को?
यस सर, स्लाइड शो सर।
ओके, तो shall I start?
Yes sir, you can start.
Okay. So, first of all, I would like to thanks all the committee member, organizer, and vice chancellor of this university, Agrawal Sahab, who organized this national conference on plant actives and herbal pharmaceuticals. So, it's my pleasure to share my views on this specific topic, that is phytopharmaceuticals, how we can translate the herbal plant material into the modern dosage form. Am I audible? Is this visible? Slide is visible or not?
Yes, sir, you are audible, and you can
Slide is
please
visible?
press F5 for full screen slideshow.
Are you audible? Am I audible or not?
Yes, sir, you are audible and you are live. Please proceed ahead.
So let's start this conversation on the phytopharmaceutical. The major task of the phytopharmaceutical right now is how we can convert the phyto material to the medicinal material, right? So as we know, our earlier colleague also shared about the herbal market, that is the huge market right now. And in the same lieu, as we know that WHO estimated about 80% of the world population rely on the herbal product, right? But there is again myth on what basis we can use the herbal product and at what extent we can use, and in which manner we have to use this kind of phytopharmaceutical without any scientific validation, because on the basis of the traditional knowledge, on the basis of treaties, we are using the plant material in the medicine. And we know in the herbal cosmetic there is the huge market. So the reason, if you see the reason is there is less toxicity, and these are easily available plant material for the so many kind of ailment to cure the ailments, and there is very less formulation stability. So such kind of phytopharmaceutical or plant material or herbal medicines are used spontaneously. जैसा कि पहले आयुर्वेदिक हॉस्पिटल्स के अंदर हम मेडिसिन को बनाते थे, तो आपको मालूम है कि दैट टाइम फिंगर रोलिंग जो टेबलेट गोली जो होती थी वो हम पेशेंट्स को डिलीवर करते थे। और आज भी आप देखिए चून और अरिस्ट, आसव, ये जितने भी हैं ये स्पॉन्टेनियस नहीं कहेंगे, लेकिन ये जो है फ्रेश प्रिपरेशन होती है जो आयुर्वेदिक फॉर्मुलेशन में हमें मिलती है, देखने को मिलती है। Now you see the phytopharmaceuticals जो है there is evidences are available in the Ayurveda and so many our Vedas, right? Say for example, अगर हम जब longevity की बात करते हैं, so that time the name only the amla, right? अमल की वृषा रसायनी चक्षुषा तृष्णा नतु and पित्तक धरती रुचिकारी दीप्यंता मेघा लघु means आमला जो है as a rejuvenator इसके अंदर यूज किया जाता है, as a रसायना यूज किया जाता है. So likewise, amla, there is lot of different plant material are being used to improve the life and to improve the longevity, to improve the so many different aspects are associated. It improve the vision, it improve the thrust, balance, पित्त वात पित्त कफ को बैलेंस करने के लिए अम्ला का जो है कि इसका काफी नाम है. वैसे ही हम टर्मरिक का बात करते हैं, हरिद्रा जिसको बोलते हैं, हरिद्रा कटुका तिष्का रुष्णा उष्ण कफ पित्तजम, यानी कि जब कफ वगैरह जो होता है, ये हल्दी जो कि हमारी किचन का एक बेसिक इंग्रेडिएंट माना जाता है, बिटर टेस्ट होता है अगर आप इसको डायरेक्ट पानी में लेते हैं तो. दूध के अंदर हल्दी का बड़ा यूज है, और ड्राई कफ होता है उसके अंदर हम इसको यूज करते हैं. पित्त बनने लग जाता है उसको वो करता है. वर्म्स को, स्किन डिजीज को, सभी जगह जो है आप इसका यूज जो है वो करते हैं, और डायरेक्टली इनडायरेक्टली हम करते आ रहे हैं, सदियों से करते आ रहे हैं. लाइकवाइज आप नीम का अगर देखेंगे तो नीम का भी जो है, इसको तो बोला गया है सर्व रोग निवारणम अनारोग्य वर्धिनी नीमम, यानी कि नीम एक ऐसा प्लांट है जिसको सर्व स्किन के लिए, पेट के लिए, वर्म्स के लिए, सभी के लिए, बहुत सारे बैक्टीरियल इन्फेक्शंस होते हैं उनके लिए इनको यूज किया जाता है. So I mean to say there is means a lot of evidences and lot of means traditional treaties are basis to use the herbal medicines. But now in the scientific era there is the problem, because all these are the organics. But in 19th century the paradigm shift towards the synthetic. फिर हम synthetic, जैसे जैसे जर्मन के अंदर synthetic chemistry जो है वो उसका एडवांसमेंट हुआ, तो डिफरेंट कंपोनेंट्स जो है, केमिकल रिएक्शंस जो है, उनकी वजह से, उन एडवांसेस की वजह से, उन एडवांसमेंट की वजह से जो है सिंथेटिक ड्रग मार्केट्स में आने लग गया. फिर अलग अलग जो कैटेगरी के ड्रग्स हैं, एंटीबायोटिक्स हैं, उनका एंटीबायोटिक्स इज द 20th सेंचुरी फिनोमिना, राइट? क्योंकि एंटीबायोटिक्स तो जब 1934 के अंदर फर्स्ट टाइम स्टडी किया था, तब जाकर पता चला कि एंटीबायोटिक्स होते हैं जो कि हमारे बॉडी की प्रतिरक्षा करते हैं. लेकिन आंवला, च्यवनप्राश, ये तो सदियों से चले आ रहे हैं. सो देयर इज लॉट ऑफ रिसर्च अपॉर्चुनिटी in the field of the phytopharmaceuticals, how we can reclothing and scientifically we can produce the data. But there is the core problem. What kind of problem? The problem is variability. अगर आज मैं हल्दी का एग्जांपल लूं तो हिमाचल की हल्दी को अगर हम आपके वहां से, बिहार से, उड़ीसा या उधर से अगर हम करते हैं, वहां की कल्टीवेशन को अगर कंपेयर करते हैं, देयर माइट बी पॉसिबिलिटी वेरिएशन इन द कुरकुमिन और कुरकुमिनोसाइड्स component percentage in the curcumin. So likewise geography as well as season and processing, temperature, humidity, lot of variables are there, sunlight, intensity of sunlight, right, time of sunlight exposure to the plant. So many things are means variables which affect the best to best variability, which affect the viability also. Low oral viability, जितने भी maximum जो plant material है इनका viability जो potent है. What are the means having the antioxidant property? Likewise, if we talk about the quercetin, the viability is only 2 to 4%. So now scientific team are working towards how to enhance the viability, right? Likewise, resveratrol, its viability is less than 1%, curcumin less than 5%. So there is lot of phenomena are associated with these kind of problems. Now the chemical instability. Once we talk about the chemical instability, hydrolysis, oxidation, right, phytocatalysis, so many things are associated. Epigalactin की अगर हम बात करते हैं, it undergoes the oxidative reactions, right? जब हम किसी फैटी मटेरियल्स की बात करते हैं, एसिडिफिकेशन हो जाता है, एसिडिफिकेशन हो जाता है, एसिड एस्टर वैल्यूज उसकी चेंज हो जाती है, इट विल अल्टीमेटली अफेक्ट द formulation stability. Then absence of validated dose response relationship, as we know, there is less clinical data. So due to the less clinical, because the mode of delivery of the phytoactives are different. Recipes are so many recipes, right? So it depends on the type of recipe, kind of dosage form, dose design. So many variables are there. If we talk about the curcumin, then you see the response relationship is 24 times variability. 500 milligram का भी response आ सकता है और 12 milligram का भी आ सकता है. It all depends on the kind of dosage form in which we are delivering or administering the that extract or plant material. So what modern medicine demand? Our demand is define the composition. We need to define the composition, consistent performance, and evidence-based outcome. Now, how we can get the evidence-based outcome? So, see, there is certainly requirement of the regulatory. वो तभी हो पाएगा जब हम स्टैंडर्ड जो है fraction, either we will use the fraction or either we will use the crude extract, right? But it should be defined. Then that extract should be characterized, right? That extract must have at least 4 to 5 markers compound, right? अब हल्दी लेंगे तो उसमें बहुत सारे कंपाउंड है. आप एलोवेरा लेते हैं उसमें 80 पीक आती है, ग्लिसराइजा ग्लेब्रा 200 पीक आती है. सो व्हाट एग्जैक्टली मींस मार्कर इज देयर जिसकी वजह से देखिए आप प्लांट के अंदर प्राइमरी मेटाबोलाइट्स भी होते हैं, सेकेंडरी मेटाबोलाइट्स भी होते हैं, राइट? सो दे सेकेंडरी मेटाबोलाइट्स आर द एक्टिव कंपोनेंट व्हिच कैन बी यूज्ड एज effective as much as a drug, right? So such kind of phytopharmaceutical demonstrate reproducible pharmacological activity, and there is certainly need, right, to perform the clinical study, right? Without this the complete study, complete dosing, dose regimen is not possible. Now this conceptual shift in drug development, right, it start by using the technology, right? Once we had facility about the extraction, right? Different kind of extraction, then drying process, right? तो अगर ये सब चीजें हमारे पास है, then we can optimize the extract, right? Otherwise crude form में अगर आप लेंगे, that is the traditional model. हम whole plant लेते थे, empirical efficacy उसकी जो है वेरिएबल होती थी. क्रूड डोजेस फॉर्म उसके होते थे, जैसे मैंने आपको बताया आसो, अरेस्ट, च्यवनप्राश, गोली, है ना, चूना, ये जो है ये क्रूड डोजेस फॉर्म है जिनको हम यूज करते हैं. बट इन द नाउ इन दिस paradigm shift towards the technology, there is phytopharmaceutical model is required, PKPD is required, pharmacokinetic study is required, pharmacodynamic study is required, right? So this shifting enable the regulatory acceptance, then only, right? Then only we can move for the clinical transition. Now you see a very interesting data about the dietary supplement. Once we will compare the regulatory गाइडलाइन यूएस एफडीए को अगर आप देखेंगे, यूएस मॉडल को अगर हम जब कंपेयर करते हैं डाइटरी सप्लीमेंट, बोटनिकल्स और फाइटोफार्मास्यूटिकल का, राइट, तो आप देख सकते हैं कि फाइटोफार्मास्यूटिकल्स जहां भी आते हैं, इंडियन मॉडल जिसको हम बोलते हैं, सेडेस्को जो है हमारी गवर्नमेंट जो है, जो सेंटर ड्रग जो हमारा हाउस है, जो रेगुलेटरी है, and they define the purpose. Phytopharmaceutical means treat and cure the prevention of the disease, right? यानी कि prophylactics हैं, यानी कि immunity modulators हैं. Now once we talk about the characterization, then if we compare the US guideline with our Indian regulatory guideline, then it gives the limit range of compound, right? Specific bioactive defined. But here in our case, आप जब यूएस में जाएंगे तो रिवर्साटोल है तो रिवर्सेटोल की बात करेंगे, क्वर्सेटिन है क्वर्सेटिन की ही बात करेंगे, कुर्कुमिनोइड की बात करेंगे. लेकिन फार्मास्यूटिकल डिफाइन करते हैं हमारे इंडियन स्टडीज के अकॉर्डिंग, सो दे अलाउ दी अप टू दी 4 कंपाउंड्स, राइट? कि 4 कंपाउंड जो है बायोएक्टिव उसमें डिफाइन होने चाहिए. क्लिनिकल ट्रायल की जब हम बात करते हैं, क्लिनिकल trials are not required as per dear norms, but here, very recently, the clinical trial is allowed, and they are Sedesco is appreciating the clinical trial in phytopharmaceutical cases. Now, what is the role of standardization? Because without standardization, it is not possible to execute. So the standardization ensure the consistency of the phytochemicals profile, right? Reproducible biological responses होंगे. जब तक हम standardize नहीं करेंगे, how we can expect the biological response reproducibility? It's not possible. We will define the therapeutic dose also, because without standardization, how you can define the therapeutic dose? Then by using, how we can standardize? So standardization is not possible without sophistication or sophisticated instrumentation technology. So by using the HPLC, UPHPLC, LCMS, we can find out the compound, right? Marker compound आपको मिल जाएंगे, right? Then you can standardize कि कितना परसेंट इसके अंदर कौन सी चीज है. Then we can move for the PKPD. तब जाके हम कह सकते हैं कि हाँ काइनेटिक स्टडी या डायनेमिक स्टडी जो है इसका ये डेटा जो है काइनेटिक और डायनेमिक के वो हमारे लिए वर्थफुल है. Now you see the why traditional dosage form are insufficient, as we know. Without any standardization, how we can say it is sufficient? So suppose in case of the extraction, right, or decoction, 50% loss of active within 24 hours, right? So that decoction cannot be preserved. Decoct material cannot be preserved for the longer period of time. Powdered chewed can be preserved, right? But the efficacy may be less due to the time, due to the exposure of environment, right? Syrup and oil may be preserved for the month, but cannot for the year. So there is some limitation in the traditional dosage form. Now the modern dosage form. What are the advantages of the modern dosage form? Because modern dosage form, modern pharmaceutical provide the dose accuracy. If your formulation is standardized, then you can fix the dose. Otherwise, without knowing the active component exact concentration in particular dosage form, we cannot fix the dose, isn't it? Then improve the stability. Once we will invoke the technology, then certainly जैसे lyophilization की आप बात करें तो lyophilization से आप stability को बढ़ा सकते हैं, right? Solubility को बढ़ा सकते हैं आप. So many technologies are involved to enhance the bioavailability, isn't it? So ultimately it enhances the patient compliance and compatibility and regulatory. It will meet the regulatory quality system. So all these are the formulation science transformation, which variability into the reliability, because without the reliability, product cannot be sold out, right? Now advanced drug delivery की जब हम बात करते हैं, so we pick the active component. Active component पे जब vigorous study हो चुकी होती है, उसके PK/PD डेटा जब हमारे पास होते हैं, then we can move for the delivery system. We can make different delivery system, right? Or in case of suppose curcuminoid, so there is the problem of the viability. So we can enhance the viability by transforming into the best delivery system like phytosome, right? So we can enhance the oral viability. Nano emulsion अगर आप बनाते हैं, it enhances the dissolution rate, right? Solid lipid अगर आप नैनो पार्टिकल्स बनाते हैं, उसके अंदर आप ड्रग को इम्बाइब करते हैं, फाइटो एक्टिव्स को इम्बाइब करते हैं, राइट? देन सस्टेनली इट कैन रिलीज द ड्रग सस्टेनली फॉर लॉन्गर पीरियड ऑफ टाइम. लिपिड बेस्ड सिस्टम जो है बाईपास हिपेटिक मेटाबॉलिज्म को. So many limitation can be overcome by using the different advancement technology. So these are a few glimpses about the phytopharmaceutical to the novel drug delivery system. Right now, so many novel approaches can be used. Now, ultimately, pharmacokinetic enhancement, how we can do so, curcumin phytosome, right? Once we compare the curcumin and another side, the prepared phytosome of the curcumin, it shows the 20 times, right, viability enhancement. Then Same in case of the lipid soluble silmarine, then it enhances the 3 to 4 times plasma concentration level of the silmarine. यानी कि हम कहीं न कहीं बायोबिलिटी को बढ़ा रहे हैं. In the same lieu, the resveratrol nano formulations अगर आप बनाएंगे, then it prolong the half life and reduce the clearance. So ultimately, means patient compliance as well as efficacy of the formulation can be achieved. Now, impact on the pharmacodynamics, as we know, means there is because once we talk about the drug moiety, right, or phytomoiety, there is pharmacodynamics actions will be lead, right. So lower effective dose once we enhance the absorption and systemic exposure, right. It reduces the dose required to achieve the therapeutic plasma concentration, isn't it? So likewise, enhance it promote the distribution, right, to target tissue through the improved permeability. Once the permeability is increased, then lymphatic uptake will be increased, and ultimately it prolong the circulation time. So tissue targeting can be achieved, right, or enhanced in case of once we talk about the dynamics. Then improve the therapeutic index, so higher or more consistent viability, which allow the effective therapy at the lower dose and reduce the systemic toxicity. So while maintaining or enhancing pharmacology efficacy, as well as it reduce the inter-individual variability also. So in a like way, we can once we compare, right, we set a goal to design the formulation, we think about the regulatory evolution. So in 2000, because in our country, it started in 2005 onward, but as per the WHO traditional medicine strategy, which has been activated in 2014, right? So they emphasize the integration of the traditional medicine through the regulation, right, and quality assurance. Because quality assurance in the synthetic drug market is very, means it plays the vital role. So same as in herbal pharmaceutical also, it require this PAQA, pharmaceutical analysis and quality control strategy. As well as in Indian phytopharmaceutical regulation, which introduced in 2015, right, with the drug category which require the purified and standardized plant fractions. जैसा कि मैंने आपको बताया कि minimum 4 marker compound उसके अंदर होने चाहिए. So by aligning all these means ICH principle or mandate, which is required the reproducibility and quality that can be validated and analytical. After that analytical characterization and toxicological evaluation, we can move for the dosage form design. Now quality control stability is also mandatory. So as resembling to the simple formulation pharmaceuticals, there is also ICH stability testing study is mentioned. So for the 6-month study, we can proceed, as well as assay microbiological assay, phytochemical instability study, right? Because there is some compound which may undergo through the hydrolysis or oxidation. So in case of the polyphenol compound, which shows the pH and light-dependent degradation rate. So phytopharmaceutical instability studies also require compatibility assurance studies also required to detect the excipient induced डिग्रेडेशन. इट मे बी पॉसिबल कि आप पॉलीमर या बाइंडर यूज कर रहे हैं तो उसकी वजह से कोई आपने सॉल्युबिलिटी एनहांसर अगर आपने यूज किया है तो उसकी वजह से वो कंपेटिबिलिटी जो है वो कहीं अफेक्ट होती हो. देन सेफ्टी लिमिटेशन. सो ऑल दीज आर दी पार्ट ऑफ क्वालिटी कंट्रोल एंड स्टेबिलिटी साइंस स्टडी. नाउ सी द फॉर्मुलेशन जर्नी. How means phytopharmaceutical comes means convert into the medicine. So you see, once we think about the curcumin, एक दो एग्जाम्पल लेके मैं आपको समझा रहा हूँ. फाइटोफार्मास्यूटिकल एक्सट्रैक्ट जो है कुर्कुमिन का, उसमें से कुर्कुमिन लिया जो कि कुर्कुमा लोंगा जो है उस प्लांट कैटेगरी से बिलोंग करता है. कुर्कुमा लोंगा जो है राइजोम होता है और जिंजिबरेसी फैमिली से मिलता है. और फाइटोफार्मास्यूटिकल जो है ये प्यूरिफाइड फ्रैक्शंस होता है, राइट। देन सॉल्वेंट एक्सट्रैक्शन, इसमें डिफरेंट डिफरेंट आप एथेनोलिक, एसीटोन और हाइड्रोएल्कोलिक जो है आप एक्सट्रैक्ट इसमें यूज कर सकते हैं। की मार्कर जो है इसमें 95% जो है कुर्कुमिन होता है और डीमिथोक्सी और बिस डीमिथोक्सी ये जो है इसमें एज ए इम्प्यूरिटी होता है। नाउ यू सी द एचपीएलसी से जब आप करेंगे तो स्टैंडर्डाइजेशन इसको करके और आप इसमें हेवी मेटल्स वगैरह रेजिड्यूज को आपको फाइंड आउट करना होता है। देन प्री क्लिनिकल इवोल्यूशन इज आल्सो रिक्वायर, एंटी इंफ्लेमेटरी एक्टिव व्हाटएवर एक्टिविटी, एंटी कैंसर एक्टिविटी, राइट, यू नीड टू परफॉर्म इन प्री क्लिनिकल स्टडी डेटा, जब हम एनुअल स्टडी वगैरह हम करें। देन क्लिनिकल इवोल्यूशन फेज 2 और फेज 3 स्टडी में आर्थराइटिस, एंटी आर्थराइटिस, ये एक्टिविटीज जैसे हमने की है तो इन वो जो स्टडी मॉडल होते हैं उनके अंदर इनको परफॉर्म किया जाता है। देन रेगुलेटरी गाइडलाइन को हमें फॉलो करना होता है। सो दीज आर द रेगुलेटरी गाइडलाइन, राइट, which gives the foolproof result, right? So likewise all these parameter is to be studied to convert one plant material into the perfect dosage form, right? So all these are the guidelines which I have to mention. Now the journey of the phyto compound which earlier mentioned. So medicinal selection of the medicinal plant, on what basis we can select, it depends on the ethnopharmacological survey. Then botanical authentication, that is also required from the authentic means library of the plant या रिसर्च सेंटर जो है वहाँ टेक्सोनॉमिक वाउचर होते हैं, उन स्पेसिमेन से उसको मैच किया जाता है और आपको ऑथेंटिफाई किया जाता है। देन वी अलाउ फॉर द एक्सट्रैक्शन। सो लैब के अंदर आप डिफरेंट मॉडल्स लगा के डिफरेंट एक्सट्रैक्शन यूनिट पे अलग अलग एक्सट्रैक्ट उनके कर सकते हैं। फ्रैक्शंस, इट्स ऑल डिपेंड्स ऑन द नेचर ऑफ कंपाउंड, राइट, एंड then according to we can select out the marker compound. So after the means fractionation we can move for the HPLC or LCMS mass compound भी आपको उसमें से जो है वो निकालना होता है। फिर स्ट्रक्चर इलूसिडेशन करके आप देख सकते हैं। then we can move for the pharmacological study in the animal. So standardized fraction or extract can be injected or orally ingested. Then after we can find out the data और स्टडी इवैल्यूएशन, देन फॉर्मुलेशन डेवलपमेंट, डिफरेंट स्टडीज जो होती है उसकी प्री फॉर्मुलेशन स्टडी अलग होगी, स्टेबिलिटी आफ्टर प्रिपरेशन ऑफ द फॉर्मुलेशन स्टेबिलिटी स्टडी अलग होगी। देन आफ्टर आपका जो है अगेन जो है क्लिनिकल ट्रायल उसको कंफर्म करेगा फेज 3 के अंदर और फेज 4 सेफ्टी एंड एफिकेसी के लिए। सो लाइकवाइज दिस इज द सोजन ऑफ द फाइटो कंपाउंड इनटू द मेडिसिन। नाउ एग्जिस्टिंग रिसर्च गेव जो है इनकम्प्लीट अंडरस्टैंडिंग ऑफ फाइटोकेमिकल साइनर्जी। दो कंपाउंड की वजह से भी बहुत सारी जो है साइनर्जिस्टिक अफेक्ट हमें मिल सकते हैं और ये चीजें अभी चल रही है। आपने सुना होगा कि पाइपरीन एज ए बायो एनहेंसर, बायो एबिलिटी एनहेंसर, तो उस टाइप से बहुत सारे ऐसे कंपाउंड हैं जिनको हम यूज कर रहे हैं, बट देयर इज लिमिटेड क्लिनिकल ट्रायल एंड स्टैंडर्ड प्रोडक्ट। स्केल अप challenges is also there because in limited facility it is very tough to produce. Technology transfer is very tough. Then cost effectiveness in the larger scale manufacturing is cost effective. Now systemic pharmacology for the multi-component drug is also required. AI assistant phytopharmaceutical profiling is also means a future for the researcher. Then personalized phytopharmaceutical formulation, it is the future forecasting. Then strong academic industry translation model is also forecasting. So likewise, we can means move for the best herbo pharmaceutical delivery system or dosage form. So now in conclusion, how we can means apply the pharmaceutical rigor into the traditional medicine. This is the first one, and the pharmaceutical, phytopharmaceutical, which implies the define the chemical characterization, marker-based standardization, right, dose accuracy and all. Then enable reproducibility, evidence-based plant therapeutics, right, by controlling the phytopharmaceutical composition, improve the pharmacokinetic dynamic parameters. We need to validate the dose, right? Then we provide the scientific pathway for the means all the integration. हर country की जो regulatory guideline है उनके according हम उसको कितना fulfill कर पाते हैं. So there is means certainly alignment with the regulatory expectation of the different country as far as concerned with the quality, safety, and efficacy. If we meet out all the means parameter and we are able to means meet out the gap between the breach in traditional and modern system, drug development system, then certainly it will accelerate the international regulatory acceptance of our product. So likewise means you can design the mechanism and hypothesis, and you can convert in one herbal plant material into the dosage form. But it is a long journey. It is means it required so many different step research facility. But in the integration, we can develop the formula or formulation for the better efficacy and safety. So this is all about means topic that was concerned with the phytopharmaceutical translational herbal research drug into the modern dosage form. If any question, any query, please ask question, so we can conclude this lecture. Any question?
Thank you, Dr. Singh, for your nice presentation and also giving a very valuable insight regarding this. So thank you from my side and from my university, Sai Nath University. Thank you, Professor.
No any question?
Mute है? अच्छा. Hello. Thank you, sir. Hello. I'm audible, sir? नहीं. चले गए. चले गए. चलिए. ठीक है.
हम आपको आज ऐसे संस्कृति से रूबरू कराना चाहते हैं जहां नृत्य केवल कदमों की चाल नहीं, भावनाओं की भाषा है। ढोल की हर आवाज में पीढ़ियों की कहानी बसती है। जहां परंपराएं ताल पर थिरकती है तो इतिहास जीवंत हो उठता है। Yes, we are talking about Jharkhand, the land of Jhar, forest, and Khand land. It is a place where nature and culture dance together. It's now time to experience the glimpse of cultural heritage. For this, I would like to invite Archana and team.
The recording has been stopped. Thank you for joining. Goodbye.
Namaskar, my name is
छोटा नागपुर के अंग्रेजों के खिलाफ क्रांति का शंखनाद करने वाले स्वतंत्रता सेनानियों की जब भी चर्चा होती है तो सबसे पहला नाम बिरसा मुंडा का लिया जाता है। बिरसा मुंडा झारखंड के इतिहास में एक बहुत ही महत्वपूर्ण नाम है।
रंजितों के याद करे कटे सब जगह मिलते जाते सब पहाड़ फिर पाचल नदी नाला हुआ देखता कटे सब जगह मिलते जाते सब पहाड़ आदिवासी के जल जमीन हुआ देखता वीर वीर सा तोर माटी तोर रंजितों के याद करे नागपुर करे कोरा ए नागपुर करे कोरा अंधेरा छटेला मधुर मधुर जे बोलेला कोयल तोर जिया डोलेला मधुर मधुर जे बोलेला कोयल तोर जिया डोलेला तो जाते काय करू चले चली वहाँ पीछे पीछे चली वहाँ पीछे पीछे
Thank you so much, everyone, for this beautiful performance.
Every successful event is the result of teamwork, dedication, and vision. And today was the perfect example of that. So let us carry forward not only the knowledge we gain, but also valuable connection we made here today.
जो सीखा यहाँ वो जीवन में उतारेंगे, हर नई सुबह को और बेहतर बनाएंगे। यह खूबसूरत सम्मेलन भले ही थम जाए, मगर इसकी यादों को हम दिल में सजाएंगे. With this, we officially conclude this session. Thank you all once again for being this part of event. Have a wonderful day ahead.